i wraz z moim
Hello, my
kolegą
name is
Jeremim Macinkowskim mam
Katarzyna
zaszczyt
Chmielewska,
zaprosić
and I would
Państwa
like to
na
invite you
drugą
to the first
międzynarodową
international
konferencję
conference
organizowaną przez
organized
Ośrodek
by
Szkolenia
the
Ogólnokształcącego SHK,
PSHK
Polskie Centrum
Training Center,
Homeopatyczne.
Polish Training of Classical
Arkadiusza Stankiewicza.
Homeopathy, chaired by
Podczas
Arkadiusz
dzisiejszego
Stankiewicz. And
spotkania
in the course of this
ponownie
meeting,
Państwo
you will
mogą
have an opportunity
wysłuchania
to
światowej sławy
listen to
homeopatów,
the well-known
wieloletnich
homeopaths
doświadczenia
with a
zarówno w
background of many years of
Polsce,
experience,
Niemczech,
both from
Szwajcarii
Poland,
oraz Indii,
Germany,
którzy
India,
będą omawiać
and
kluczowe
Switzerland,
kwestie z
who will be
zakresu
discussing
homeopatii
key
klasycznej.
issues connected with
Czym jest
classical homeopathy.
homeopatia oraz jakie ma
What is
możliwości
homeopathy?
terapeutyczne?
What are
Sposób,
the
żeby wspierać
therapeutic
pacjentów podczas
possibilities? How
terapii
can we
onkologicznej.
support patients in
Mamy
the
nadzieję, że
oncology treatment?
konferencja
And
otworzy
we are hoping that
drzwi
this
do wszystkich
conference
Państwa
will
pytań, jak
answer many
służbowe,
of the
medyczne
nagging
lub
questions that you have, and
terapeutyczne,
also will
żeby
show
osiągać
the
skutki
effective
pomocy
therapeutic
leków
options
homeopatycznych.
where you can
Dzień dobry,
achieve
Jeremi.
using the homeopathic remedies. Hello,
Pierwszego prelegenta.
and this is the first speaker, please.
Dzień dobry
Jeremi.
Państwu, nazywam się Jeremi
Hello, my name is
Masinkowski,
Jeremi
będę
Maszankowski,
prowadził
and
razem
I
ze
will
swoją
be
przyjaciółką i koleżanką
co-chairing with my
Katarzyną
friend Katarzyna
Chmielewską
Chmielewska
tą konferencję.
this conference.
I
And
dzisiaj, tak jak już
today,
zostało to
as it
powiedziane,
has been
będziemy
already
mieli
mentioned, we are going to have lecturers
z różnych kontynentów
from all over,
działających na
from many
wszystkich
continents,
kontynentach
actually operating around the globe,
wybitnych homeopatów. Nie są to
renowned homeopaths.
osoby,
And these are not
które tylko i
persons
wyłącznie
who not only
zajmują się
deal
homeopatią,
with this
ale są to
field,
osoby, które
but these
mają
are also
olbrzymie
persons who
doświadczenie,
have a large
które
experience,
włożyły olbrzymi wkład w
who made a large
homeopatię
contribution to the
i na
development of the
pomoc
field
homeopatii,
and
wiedzę z
homeopathy
homeopatii,
awareness
z
as
czego
well as knowledge,
korzystają w homeopatii
which
dzisiaj
is
zawodowi homeopaci
used by the
dosłownie
professional
na wszystkich
homeopaths
kontynentach. Ich
all over the world.
działalność
Their activities
wszystkich naszych panelistów
of all our panelists
tak naprawdę rozciąga się na cały świat dzisiaj.
spans
Także są to,
the
można
globe.
powiedzieć, wybitne osoby.
So these are
Wybitnymi
really eminent
osobami.
personalities
I
with
jesteśmy
great
niezwykle
achievements. And so we are very
wdzięczni,
pleased
że
and
zgodzili się
grateful that
wziąć
they've
udział w tej konferencji,
consented to
przyjęli nasze
participating and
zaproszenie.
that
Kiedy
they
mówię
received
nasze,
our invite. When I say our invite,
to nie jest to wcale nasze zaproszenie, jest
it
to
is not
zaproszenie
our
jednej
invitation. It
wyjątkowej
is an
osoby.
invitation of one
Jest to nasz
extraordinary person who is
homeopata polski.
our homeopath from Poland.
Nazywa się dr
His name is Dr.
który od
Stankiewicz,
kilkudziesięciu
who
lat
for
praktykuje
a number of
homeopatię,
years has
uczy
been
homeopatii.
practicing homeopathy.
Jest
He's
zarówno
teaching it.
praktykiem, jak i
He's a
naukowcem,
didactic, but also
jak i
a researcher,
homeopatą, który
but
przyjmuje
also
ludzi w
a
gabinecie,
homeopath who is seeing
ludzi
patients in the
podczas
cabinet,
terapii, którzy przychodzą
in his
zaniepokojąc
office, who
swoim
come
zdrowiem
concerned with their health,
wszystkim tym pomaga.
and
Nie
he's helping
tylko
them.
osobom
Not
potrzebującym
only
pomocy,
the
ale
needy
również tym,
persons,
którzy
but also
chcą takiej
those
pomocy.
who would like to
Także przedstawiam
provide some
doktora
assistance. So
Arkadiusza
let me introduce Arkadiusz Stankiewicz,
który będzie
who
naszym
will be
pierwszym
our first
mówcą.
speaker.
Panie doktorze, bardzo
Doctor?
Dzień dobry.
Hello,
Dziękuję
everyone. Thank you very
moim
much
przyjaciołom
to my friends for this kind introduction, not only of my person, but our speakers,
z czego jestem bardzo
of which I'm
zadowolony,
very
że
pleased.
chcieli z nami wystąpić.
The sheer fact that they were
Chcą
willing
się
to
podzielić
take
swoją
part
wiedzą.
and they want to
Bardzo
share their knowledge, I'm very grateful for that.
Tak szczególnie jedną
I
osobę
also wanted
przywitać.
to warmly
Dr.
welcome
Jens
one
Wurster,
person,
który
and Dr. Jan Wurster, who
obchodzi
today
urodziny i pomimo
is celebrating his
tego, że
birthday,
to
and
jest
despite the
jego
fact that
dzień
this is
urodzin,
his
znalazł
birthday,
czas na to, żeby
he
podzielić
made
się
his
z
time
nami
available to
swoim
share his
doświadczeniem.
experience.
Wiem, że mężczyźni nie
I
lubią
know that the
mówić o
men
swoich
don't like to
urodzinach, o swoich
reveal
latach,
their
które
age,
odcisnęły już piętnem na
which have left
ich
quite an indelible
przebiegu. Ale
mark
mogę
on
powiedzieć,
their great
jeżeli
countenance,
na
but
tajemnicy,
I can tell you
że Jens zbliża
that
się ku
Jens
albo
is
go przekroczył już troszeczkę tylko
getting
wieku
to or
Balzacowi.
exceeded
A ja
the
zapraszam
Balzac's
wszystkich
age,
was
and
na moje
I would like to
tutaj
invite you
moją
to
prezentację
my
teraz,
presentation
którą
right now,
zaczynamy
which we
tego,
will
od
start
możliwości
from the capabilities
homeopatii,
of
które
homeopathy,
przed nami ona stawia.
which
Musimy
it presents.
pamiętać,
We have to
że
remember
często
that
się
quite often we see sick persons coming to homeopathies asking, can you help me in this case? Of course, homeopath doesn't have a crystal ball where he could see the future. The only thing that's left, which he has, is his vast experience and the words of comfort, so that the majority of patients is getting what they came for, a path to health. A homeopathy, let me reveal this, is not expecting that our patients will believe in homeopathy, because you don't have to believe in it. I will present a case of multiple sclerosis, SM. From 10 days ago, this person came to my center. He was around 40 years old. And before he came to me, he asked me whether he should believe in homeopathy. And only because I said that the faith in homeopathy is not necessary, he decided to take this chance. Was it a good decision? I think so. Only after a few days of therapy, which was carried out in our center, his mobility improved significantly. He left the center on Monday, and I have a daily contact with him whenever there is a change of his functioning. Because let me reveal another secret. To administer a medicine and not having a contact with a homeopath is a great difficulty, because you can see various responses, and homeopath is supposed to monitor the responses of the body and to navigate the patient, whether we should increase or decrease the dosage, or should we dilute it or keep it at unchanged. All that can be experienced by the persons who are coming to our center. And I can also say that the pictures of this patient is not shown, but some of the symptoms so most of the people ask, what does it have to do with SM and or MS? And I have to say that my patients was using a lot of substances to get rid of this problem. And when he was recovering, the occurrence of these facial problems signal that we are going in the right place. The skin changes, which we see on the patient's skins, are often a green light that we are moving in the right direction. What improves is the functioning of a patient. Also, the mood shifts positively, and the fact that skin changes appear, it signals that we're moving in the right direction. However, we may pose a question in the course of the treatment. This guy is not happy with his facial changes, and he's using various remedies to eliminate it. And in this way, he could eliminate the therapeutic possibilities of homeopath. So I can tell you the secret that at the end of the day, he would say that homeopathy does not work. Would that be a truth? If we suppress the symptoms during the treatment, we can see the recurrence of the disease. Another thing in this patient is the fact that we saw some other skin changes. We recall that these skin changes were appearing many years ago. And if I asked you the question, what would have happened if these changes were treated, I think that most of you would have said one thing:
nastąpiłby nawrót choroby.
the recurrence of the disease would happen.
I nie trzeba wierzyć w homeopatię. Natomiast trzeba ufać homeopacie, że wie, w którą stronę idziemy.
We have to trust
którą
the
drogę
homeopath so that
następuje
he
powrót
could
do
know in which direction we are going, in
Często
which direction
pacjenci
there is the
pytają się,
recovery.
jaką
Patients
czytać
frequently
książkę.
ask what kind of
Jedną z
books they should
podstawowych
read.
książek, jaką
One of the
chciałbym
basic books
polecić,
that I would like to
to jest
recommend
książka
is
Podróż choroby doktora
the book
Mohingera
on
Dinkelsy.
the
Książka wydana jest również w języku
journey of
angielskim.
disease,
Czytamy
and this is
Reise,
also
Wegdarkheit i
published
mamy
in
to,
English,
Journey of
well, in the
Disease.
German. This is the journey of disease.
Ta sama pozycja jest wydawana w
The
różnych
same book is also
językach
published
i
in
mówi
other
zawsze to
languages,
samo.
and it also refers to the
Jeśli
same.
oddziałujesz
It
na
says that
skórę,
if you act on the skin,
to może się jednej rzeczy spodziewać.
you may
Tylko
expect
tego,
just one
że
thing. You can expect only the fact
dolegliwości
that
idą w
the
głąb organizmu. Dr. Hughes, tak samo
injury
jak
that you
większość
have, the
homeopatów,
pain
ma
would
wersję
go inside
niemiecką.
the organism.
Organon de
Here I
Heilkunst.
have
To jest
the
książka
German
dla
version of the
fachowców.
book, and this is the
Dla
book for
fachowców,
experts. It is the book for
którzy
real experts, people who
kontynuują
continue
dzieło Hahnemana we współczesnym świecie.
the work of
Bo
Hahnemann in the
spotyka się
contemporary
nieraz
world,
z
because
opinią,
frequently I observe an opinion, I
ten
hear,
pan
wow,
żył ponad 200 lat temu.
he
Trzeba
lived
wszystko
over
zmienić.
200 years ago. Everything will have to be changed.
Wydaje mi się to troszkę
But I believe that
nierozsądne.
it is not very
Możemy
reasonable. I
wzbogacać
believe that we
to,
can
co
simply
Hahnemann
enrich
stworzył.
what Hahnemann created.
Natomiast czy
However,
warto zmieniać coś,
is it
co
really
jest
worthwhile
perfekcyjną
changing
koncepcją?
something which is a
Według mnie
perfect
nie.
concept? I believe that it is
Natomiast
not really the
czasami
case.
nasze ego
However,
podpowiada
sometimes
różne
our ego
rozwiązania,
would give us a hint
czasami
of
brak
different
naszego
solutions, and
doświadczenia
sometimes
i
the absence of
młody
our
umysł.
experience,
Sam
as well as the
pamiętam,
young
że jako młody
mind. Well, I
homeopata,
remember myself that when I was
można
a young
powiedzieć, miałem
homeopath,
trochę rogatą duszę
well, I was
i
quite
nie zawsze
a
ze wszystkim
rebel,
się
and I
zgadzałem.
did not always agree with
Lata,
something.
które mi zostały dane na tej ziemi,
The years that were
nauczyły
given
mnie
to me on
pokory
earth
i dalej
taught
uczą,
me
bo ta
humility,
podróż
and they
trwa
keep
całe
teaching me
życie.
humility because that journey takes the whole
Chciałbym
life.
teraz przejść do
And now I
kolejnego
would like to
tematu,
move on to another
jakim jest
subject, and this subject is
porównanie
connected
homeopatii
with the
z
comparison
nauką.
of
Czy możemy w ogóle
homeopathy
się
with the
pokusić o
science?
to, że
Can we actually
homeopatia
make the effort and
jest
say that homeopathy
wytłumaczona albo
is
nauka tłumaczy, w
explained, or
jaki
actually that the
sposób
science
homeopat
explains homeopathy
Mamy w
in
nauce
any
taki
way?
model,
In
w
the
nauce
science, we have this model.
akademickiej,
In the science, in
model
the world of academia,
salutogenezy.
we have the model of
Model
salutogenesis.
salutogenezy mówi nam
The model of
że nie
salutogenesis
jesteś
tells us
chory
one thing, that
czy
you are not
zdrowy,
sick, you are
tylko
not
idziesz
healthy.
w
You
zdrowiu
simply are
lub
going
idziesz
towards
w
health,
chorobie.
or you are going
Co
towards the
to
disease.
oznacza?
What does
Że
it mean?
zdrowie to nie jest
It means
punkt
that health is not
stały,
just a
tobie dany na
permanent,
całe
constant
życie.
point,
To
something
jest
given
punkt,
to you
do
for the rest
którego
of
się
your life.
możesz
This is just
zbliżać
a
lub
point to
oddalać.
which you can get
Podobnie jest z
closer, or you
chorobą.
can go further away
Punkty
from it. The
stałe
same
dla
goes for the
każdego
diseases.
człowieka
There
to
are
są
some constant fixed points
wtedy,
for every
kiedy
person,
już
and they
opuszczamy naszą
can be
ziemską
applied when
podłogię.
we
I
are
wtedy
dying,
rzeczywiście nic
and
więcej
then
nie
nothing
możemy dla
else
naszego
can be
ciała
done for our
zrobić.
body anymore.
Ten model salutogenezy
The model of
jest bardzo
salutogenesis
zbieżny z
is
homeopatyczną
highly
koncepcją
convergent with the
powrotu na zdrowie.
homeopathic concept
Hahnemann
for the
twierdził
recovery.
200
Hahnemann
lat temu,
stated 200 years
że
ago
zdrowie to nie jest
that
nic
health
dane nam na
is not
stałe.
anything that
To
is
jest
given
coś,
to
do
us for
czego
good. This is
zmierzamy
something that we
lub
are
coś, co
striving at,
możemy
or
tracić
something
poprzez
that we
nasze
can
działanie.
lose by means of
Jakie
the actions that
działanie?
we
Na
undertake.
przykład
Which actions?
stosowanie
For example,
różnego rodzaju
the
substancji,
administration
które
of various
mogą czynić
substances that
fizjologiczne
can attenuate
reakcje
physiological
każdego
reactions
człowieka,
of every
takie jak
person.
czulenie
Like,
potu,
for example,
takie jak deprywacje naszych
suppressing
narządów i tak
sweating,
dalej.
sleep deprivation,
Dla
and
mnie
others.
model
For
salutogenezy
me, the model of
jest wskazówką
salutogenesis
i
is an
implikuje
indication, and it simply implies
konieczność dalszych badań
the
nad
necessity of
homeopatią.
performing further studies on
Powiem wam w
homeopathy.
zaufaniu,
Let me tell you one more
że
thing in confidence.
jest to coś, o czym myślę codziennie, coś, co
This is
nie daje mi
something
spokoju
I am
i
thinking
coś, co
about
uważam
every day. It is something that
podporządkowane
does not give me a peace of mind,
dla
and I
dobra
think that it should be
pacjentów,
ordered
bo
for the
koncepcja
good of our
homeopatyczna,
patients,
która będzie w
because
100%
the
nam
homeopathic
wytłumaczana,
concept that will be
będzie
explainable in
służyła
100%
pacjentów, będą
will
mieli
serve the
korzystali z
patients.
homeopatii w
They will
ciężkich
use
stanach.
homeopathy in
I mogę
difficult
wam
conditions.
powiedzieć
And I
jedną
can
rzecz.
also tell you one more
To nie
thing.
jest ważne,
It is not really
gdzie idziecie,
important
czy to
where
są
you go.
Indie,
It is
czy
not
to
important
jest
whether it is about
Szwajcaria, czy
India
to
or
jest
whether it is
Polska. Nie.
Switzerland or whether it is
Ważne jest
Poland or
jedna
Germany.
rzecz,
What is important
żeby
is one more
homeopatia
thing.
była
It is important that
stosowana
homeopathy
zgodnie z
is to be
zasadami
administered in line
Hahnemana.
with the principles of
Hahnemann
Hahnemann.
powiedział coś takiego.
Hahnemann said
Jeśli stosujesz
that
to
if you
niezgodnie z tym, co
use it
napisałem, to nie
not
jest już
as I wrote,
homeopatia.
then it is not homeopathy anymore. You simply have to observe
I
my
na końcu mojej
guidelines.
prelekcji
At
chciałbym
the end
wam
of my address, I would
przedstawić
like to
jeszcze
introduce to
jeden
you
case z tego
another
roku.
case from this year.
Mały pacjent
A little
zgłosił się do
patient
mnie
came to
z
me
podejrzeniem spektrum autyzmu.
with a suspicion of autism
I
spectrum.
możecie zobaczyć,
Here
jak
you can
on
see
się zachowuje.
how he behaves.
Ma podejrzewany autyzm, tak?
Olaf is a suspect of autism. He's hyperactive. He doesn't control his emotions. His balance is upset very easily. He can't focus. If he's upset, he starts yelling. On the first day after the administration of the drug, he was quieter. Yes, he was quieter. He was calmer. You let me know that some of the symptoms that did not present for a long time, they started again, waking up at night. And do you remember what I told you at that time? What had to be changed? I said that we will change the dosing. Yes. And if you were to evaluate in the scale between 1 and 10, on day 6, what it was like, what is the improvement? I believe that it is at 10. This is the improvement at the level of 10 because we really can see quite significant improvement, quite significant changes.
Wydaje mi się, że to, co
Okay,
powiedziała
I
mama,
think that what mom said
wystarczy, żeby
would be
podsumować
sufficient
pobyt tego
to
chłopca.
sum
Powiem
up
więcej. Dzisiaj mamy drugi
the
czy
case of
trzeci
this boy.
miesiąc
Today it is month 2 or month 3
terapii u tego małego
of his
pacjenta
treatment,
i nigdy nie doszło już do nawrotów, do powrotu
and never before, never again he had any relapse. He didn't wake up during the night with a scream. His mom is today saying he's not actually firing up. Can it be anything better for parents? My child does not fire up. You are more quiet. You are calmer. These things are given only by homeopathy. No side effects, with a good result for a patient. And as Hahnemann said, we are here aspiring to the recovery of health from the time of the disease. And this is what is important for me from the point of view of managing our patients who expect help to be provided to them in my office. Doctor, we can see here a significant pace of therapeutic progress. How is it possible? We hear from other therapists frequently that we have to wait to see the therapeutic progress for quite a long time. The answer to this question is one. Every homeopath who has a stationary place where they have the possibility of observing their patients every day has a possibility of adjusting doses for the reactions to be intensive, to be powerful. And if they are powerful, if they are intensive, the homeopath will have to know what to do, what steps should be made in order not to overload the organism and to make sure that the result is also satisfactory for the parents. Here we can see some difficulty if we do this in our office. In our office, I would actually give individual doses with the solution, but definitely they would not be administered as intensively as it is the case in the center that I run.
Panie doktorze, jeśli można, bo
Doctor, if
wspomniał
I
pan o
may,
ośrodku.
because
Do
you
nas też
mentioned
dotarła
a
informacja,
center,
wiele
we
jawnych
also
źródeł pańskich,
were
można,
informed, let me not tell you the
że od
source of that
niedawna
information,
istnieje
that
taki
since
ośrodek
not long
stacjonarny
ago there has been
i
such a
ja nigdy o
stationary
czymś takim nie słyszałem w
place,
Polsce.
such a
Owszem,
residential center. I've never heard
szukałem
about
w
this in Poland.
internecie,
It is true
to
that when I
nie
was
za bardzo
looking for
różne
that
gabinety
information online,
homeopatyczne i tak
I found
dalej, ale
different
zazwyczaj to były takie
homeopathic
samotne wilki,
offices, but
jak
those
to się
were like
mówi,
lone
i
wolves,
ludzie
if you
przyjmujący po
will.
prostu
And
w
people who were
gabinetach, tak,
receiving their patients
takim
in
leczeniem,
the
można porównać, zachowawczym. A
offices where
proszę mi
they were treating
powiedzieć parę
patients
słów o tym
conservatively. Can you
ośrodku
please say a few
stacjonarnym,
words
bo to
about that
brzmi niezwykle
stationary
interesująco, ale też
residential center?
intrygująco.
Because it is quite interesting
Idea
and intriguing at the
ośrodka
same time. The idea
stacjonarnego
of that
powstała
residential
podczas
center
mojej
was
podróży
created when I was
do Indii,
visiting
czyli
India.
wizytując szpitale doktora
Or- And when I
Farocka
visited
Mastera,
hospital of Dr. Farok Master,
z wizytą u profesora doktora Pradipa Kuma,
or when
miałem
I visited
przyjemność
Dr.
oglądać
Pradikuma, I had
rzeczywiście
the
funkcjonuje
possibility
i
to see
rozumie
that
się
it really
przelecenie.
worked
Ten
there and the
pomysł
treatment was
na
much faster.
tworzenie i szybkość
The
leczenia
idea
trwał
for the creation and the
u
speed of
mnie od
treatment
wielu, wielu lat.
has
Myślę,
been
że
going on
słuchacze,
in my case for
którzy
many, many years.
wyszli
I believe
pod
that
moją
the
strzechę, mogą
listeners,
powiedzieć,
the
że
audience who
inaczej
were
nauczałem
trained
wiele
by
lat
me,
temu,
they can
dawkowałem
admit that
inaczej,
I
teraz
treated,
jeżeli
I
widzę,
taught
że coś
dosing
działa, może
differently in
tam
the past and I
modyfikuję.
teach it
Ja
differently
mam
now. If
jeden
I can see
cel.
that
Ten
something does
cel
not work,
jest
I modify
taki,
it.
żeby
I have
homeopatia
just one objective. My
uzyskała
objective is for
należne jej
homeopathy
miejsce
to
w
get the
panteonie
place it deserves in the
innych
pantheon
terapii
of
i
other
żebyśmy
therapies.
my jako
And so
homeopaci
that we
robili
as
to w sposób
homeopaths could do
służący
this
naszym
in a way
osobom
that
jak
also
najlepiej.
serves us as
Powiem w
well
ten
as
sposób.
possible. Let me
Ośrodek
tell you
to
as follows. A
przyjemna
residential
praca,
center is a very
pełna
pleasant work,
pasji.
full of
Natomiast
passion.
jeśli nie masz
However,
czasu,
if you don't have
jeśli
time,
planujesz
if
wakacje
you
co
plan
miesiąc, no to nie
holidays
jesteś
every
w stanie
month,
takiego
then you are not
ośrodka
able to
prowadzić, bo powinien
manage
być
such a
praktycznie
place
dostępny
because you should be
non-stop
available
dla
there
wielu chorych,
non-stop
którzy
for
są
people
u
who
siebie.
are sick and who are
Czyli
staying
jak
there.
rozumiem, jest to
If I
całkowicie
understand, it
stacjonarny
is absolutely
ośrodek,
a
gdzie pacjenci
residential
przebywają czy
center where
przychodzą codziennie, tak?
patients are staying
Ośrodek
there
jest
or they come every
stacjonarny,
day.
gdzie
It's a
codziennie mamy
residential center,
wizyty
and every
2,
day
czasami 3 razy, a czasami tylko jeden
and
raz.
we have the
Jeżeli
appointments
widzę,
like
że cała
twice, three
terapia
times a
idzie
day, sometimes
super,
just
no
once.
to
If I
ograniczam
see
się
that the
do
whole
jednej
treatment
wizyty.
takes
I
very well, I
wskazuję
am just
obie
limited to one
wskazania
appointment. And this is the
Gorzej,
well,
proszę
with
od
this
razu
indication,
o
if
kontrolę,
something is a
proszę
little bit worse, I
poinformować od razu
ask for the checkup.
tutaj
I
moją
then
asystentkę,
say,
żeby
inform my
wiedział, że muszę
assistant so
proszę,
that
jeśli coś
I should know
podjąć.
that I have to interfere
Ale jak
and
rozumiem, to
adjust
są
it.
wizyty
But I
od
understand
jednego do trzech
that those
razy
are the
dziennie.
appointments between
Tak,
one and three
jednego do
times
trzech
a day.
razy dziennie.
Yes, between one and three times a day.
Jeremi, myślę, że powinniśmy zrobić trochę
Jeremy, I
wakacje
think
i
that we should
odwiedzić
also take some
ośrodek.
holiday and we should
I się
go and visit
podleczyć po
that center
prostu.
and get some additional
Gorąco
treatment. Yes, of course.
zapraszam,
I
także
strongly encourage
A
you to
jeszcze
come.
pytanie, panie
Let me
doktorze,
ask
przepraszam, że
another
przerwałem. Jeszcze
question,
pytanie, a
doctor.
gdzie się
Sorry for
znajduje ten
interrupting you.
ośrodek?
And where is this center located?
Ośrodek PSHK znajduje
It
się w
is the
Gdyni.
PSHK
Pracujemy już nad
center
pracuję
and
już
it
nad
is in
zmianą
Gdynia.
również lokalizacji, bo
And
powiem
I'm
prawdę,
already
potrzebowanie jest
working on the
bardzo
change of
duże
location because I can see that the
i
demand is
ludzi,
huge.
którzy cierpią,
And
którzy
people who
chorują,
suffer, people who are sick,
przybywa nam z każdego roku. Wynika to z jednej rzeczy, z tego,
their
że
number is
coraz
growing.
więcej
It just results from one
mamy
thing.
do
It
czynienia
results from the
z
fact that we are having to do
chronicznością
with the chronic
chorób.
nature of the
Ogólny
diseases.
stan
The
społeczeństwa
general
się
condition of the
pogarsza,
society
nie
is
poprawia.
worsening. It is not really improving, it
Też
is
mam takie
worsening.
wrażenie.
It is
Kasia,
also my
przepraszam
impression.
cię, pójdź do
Kasia, sorry
Wisły,
for that.
bo to
Pack
jest
up
Gdynia. Jedziemy tam na ośrodek.
your luggage
Znaczy,
because it is
będziemy
Gdynia. We
chcieli,
have to
bardzo
go there.
chętnie.
Yes,
Także, panie
I
doktorze,
would
widzimy
love
się
to.
latem.
So, doctor, let us meet
Okej,
soon, and it's
widzimy
going
Bardzo
to be in
dziękuję,
summer.
bardzo
Very
dziękuję
good.
za
Thank you very much.
prezentację.
Thank you very much for
Mam
the
jeszcze jedno
presentation.
intrygujące
I have
pytanie,
another
które
intriguing question,
nasunęło mi się
if I
właśnie w
may.
trakcie
And
prezentacji.
it
Panie
came up
doktorze,
during
wiele
the
się słyszy od
presentation.
różnych
Doctor, we
terapeutów,
hear from
że
different
organon
therapists
sztuki
quite much
uzdrawiania jest
that
martwy, ponieważ
uh,
został napisany
that
200 lat temu, jest
that book is dead
nieaktualny
because it
i
was
nijak się
written
ma do
200 years
naszej
ago. It is outdated
rzeczywistości.
and it has nothing to do with our
O tym nam
reality
słyszeliśmy
today. We heard from you
zupełnie odwrotne
that it
zdanie.
is
Proszę o
totally
kilka słów w tym
reverse. So,
sensie.
can you please say
I
a few
to
words about that?
podtrzymuję. Dobrym przykładem
And
jest to, że
I
w
would like to
materii
keep it up. It
Medica
is a very
dyskrosy, to jest
good
określenie
example that in
kół
Materia
homeopatycznych
Medica,
i
which is a book with
możliwości
a list of
terapeutycznych
homeopathic drugs as well
Hahnemana,
as
nie
homeopathic
ma
possibilities of
takiego
Hahnemann,
leku
We do not have carcinosin. It is a drug that is introduced today for the treatment, the homeopathic treatment. It is just one thing. We have drugs that are introduced to spread therapeutic options, but for them to be introduced to materia medica, we have one thing to be done. We simply need the very good drug tests. We can't do this on the basis of just one test or on the basis of our suspicion or what we expect or when we look into the space. Hahnemann was actually doing this on the basis of the drug tests. And I believe that it is reasonable and it serves just the purpose that when we are going that path, we will be working for the sake of our patients.
Okay, so despite 200 years almost, the paragraphs in this book are still alive and kicking. Yes, I said today at the beginning of my journey, well, I was making statements against the old masters, and I have to confess today. However, when the years went by, when reading this organ book, I come to realize, and what dawns on me is the increasing homeopathic therapeutic possibility. Let yourself sit in an armchair with organon, not just a crime story that you will spend only 2 hours, but take the book, take one paragraph at a time, and spend enough time, whether what's written there is right or not, whether you agree with that or not, have a critical approach to every word. This is what I've done. But the criticism should serve the purpose, just like in my case, that it shows me that this is a therapy made and supposed to be one of the best therapies nowadays, where we have the possibility to use in patients. Thank you very much to our doctor, Arkadiusz Stankiewicz. We're going to see him at the end of the conference, so we will have another opportunity to pose a number of questions. But right now, I would like to welcome our speaker from Switzerland, Martin Jus, who is the director of a Swiss SHI Center. She's got an experience of more than 20 years, who is the author of many publications on classical homeopathy, but she's also a lecturer in various seminars in Europe, but not only. And often she comes to Poland, where in the course of homeopathy seminars, she's sharing her experience and is a guest, often in our PSHK team. Let me welcome you very warmly.
Herzlich willkommen in diesem kurzen Vortrag, den ich halten werde. Vielen Dank an Dr.
Thank you very
Stankiewicz
much,
und sein Team für die Organisation dieser
Dr. Stankiewicz, for organizing this
Online-Konferenz.
conference
Mich sehr dabei zu sein.
online, and I'm very pleased that I can participate.
Gut, wir starten jetzt.
All right,
Wir starten jetzt das Thema von
let us kick it
meinem
off, and we will commence
Warum sind wir krank?
by
Und das
a topic of my conference and my
aus
paper, Why
homöopathischer Sicht.
Are We Sick in the First Place? And of course, we'll take a standpoint of homeopathy. And in this field, we can see things differently when it comes to the root cause in comparison to the classical medicine. The commencement of sickness, illness in homeopathy is perceived not on the physical sphere, but we are referring this to the energy sphere, and this sphere is located inside a human being. What we can see the symptom. For example, we feel pains. It's only the end effect of the process. And I can give you this simple example that will goes a long way to demonstrate that. Let's assume that somebody had a problem last week at work with his colleague. And let's say this is a colleague with whom the relations have been difficult, and he got really frustrated and angered by this colleague in front of the boss and on another colleague. But this particular person, it was really negative experience. He didn't say anything, just swallowed. He had this long face. He was unhappy, but he just carried on in the day. But in the evening, he didn't want to spend his time with his family. He kind of withdrew, was upset, and woke up next day with strong pains of his arms and backs. And the back pains are the result of this stress that he swallowed, this anger that he felt when he had a quarrel with his friend. And if I give him any medicine which will make him stop feeling the pain, I will apply massage or give him a pill, will not solve the problem, of course. His health will improve for a couple of hours, but the problem will occur because the root cause of this pain, of this disease, does not lie in his arms or back. It is in his emotions. The root cause is the so-called swallowed anger. And if we administer a homeopathic mean, which will be matching to what caused the pain in the first place, then first he will feel better in terms of his being, of his me as a human being. He will feel better. He will not have a sense of willingness to withdraw, to respond with aggression, and then his pains will go away and his health will improve. So this is the sequence of the action. When we feel a pain of head or knee, we are not treating the head or a knee, we are treating the inner side of the human being in its entirety, in his whole being and human being. In homeopathy, we understand that the disease or the symptoms of this illness are just warning signals that our vital force is diminished. This is a force which ensures harmony and making sure that our soul and my body are in sync and harmony. This is the strength which makes sure that this invisible me inside me feels well. And of course, it is not something that we can see under the microscope. And under homeopathy, we say about this vital strength and vital force, and this vital force can get out of sync, out of harmony. It may be caused by a number of factors. We'll take a look at that later. But if this imbalance occurs, this vital force cannot protect us and is paving the way for diseases, which means that if I have a flu or I have some headaches or I'm contracting a serious illness, or it is a lighter kind of disease, then this is always an end effect of a problem rather than a problem itself. It's just like a question about the object and its shadow. The symptoms are like a shadow. And what is the real object is myself. And you have to treat this inner me. Under homeopathy, or its therapies, is the fastest way to get to the root cause of the disease and improving the health. This vital force is like our inner doctor, which protects us, and it can be weakened by a number of factors, because as human beings, we are very sensitive. It is easy to intimidate us, to anger us. It is easy for us to feel overwhelmed and hurt, and so on and so forth. And all that we consider as psychological aspects or factors which are contributing to an onset of disease. These are some external states which impact us and affect us negatively, just like somebody angered us, and that leads to the disease. We know as homeopaths that this is the case. This is what we see every single day. And this is not important whether we are talking about MS or cancer or a migraine or just a kind of upper respiratory problem. It is often found in the psychological sources. As a homeopath, in the course of my career, I was lucky to study with Dr. Stinkers, who was a master of the field, and his knowledge was incredible, reaching very much in depth. And we saw the patients who would come from all over, from very far locations, and these were often representatives of wealthy millionaires from Germany. And he was about 56 years old. I was a very young homeopath, and I was able to witness how is he dealing with his patients. And at some point, I saw this lady visiting, who presented a chronic disease of intestines, and the question of the doctor was, what happened 30 years ago? Because this disease had lasted for more than 30 years, and she says, my husband had died shortly before. And how did you react to that? Well, I had to be strong, you know. My children were young. I could not afford to cry and to show sadness. I needed to carry on, and shortly afterwards, I got sick. And Dr. Hughes said, all right, it matches in terms of the timeline. Since then, are you able to cry? No, I'm not able to, since my husband had died. And Dr. Hughes was not having any more questions. Naturum verticum was something which he administered based on the salt which were administered in homeopathic doses, and he quickly explained what was the relationship between intense disease and the kind of deep sorrow which was in her and that couldn't get out. She was not able to cry, so she was bleeding inside her intestine, and she was quite skeptical about this explanation. And for 2 weeks, we didn't have any contact with her. 2 weeks later, her son called and said, for 2 weeks, my mother is lying in bed and crying, and she's depressed. We need to hand her over to a psychiatrist. And you said that this is a response to healing.
That was the reaction to homeopathic substance. That substance simply triggered what was collecting within her for 30 years. That was not depression, that was the reaction of treatment. And soon after that, that woman started to feel better. She started to feel stronger. She started her telephone contact with my husband, and 3 months later, she returned to Switzerland. I was there, and when the question was asked how she was, she said, well, a miracle happened. I don't have any symptoms. I don't have any bleeding. I have no diarrhea, and I feel really very well indeed.
Indem man auch die Wurzel mit berücksichtigt. Die Wurzel war in diesem Fall unterdrückte Emotionen.
We have to go to the roots of the problem, and in this case, these were the emotions, and those emotions were originally suppressed. I cannot treat this woman, treating her with cortisone or with some other substances that are used for the GI tract, because the GI tract is not a problem. It is simply a shadow that is connected by that. And this is how homeopathy works in the treatment of chronic diseases. And this really is an incredible possibility that we have. Obviously, it is not only about some mental factors that can influence our living force. These can be also some other external factors, cold or tropical heat, accidents, poisoning. If we eat poisoned food, for example, infected with salmonella, then obviously the probability will be high. But salmonella would not be a root cause, because as it frequently happens, 5-10 people are invited to a party and everyone eats exactly the same dish. And then out of all the people who attended the party, only 5 people or 4 people or 7 people or 3 people, they really have salmonella, but it does not apply to all 10 of them. And this is also about the strength and the power to live. And if we have a closer look, who actually went down with salmonellosis, we may realize that this person may have been tired, or that person may have felt badly on that particular day.
The
objective of the homeopathic treatment is not the treatment of symptoms. When we talk about chronic diseases, we know that the objective of that therapy is to remove the ailment. For example, as we have hay fever, the tendency of catching cold, This is what we want to remove. We want to eliminate this. Obviously, in homeopathy, if someone has hay fever and someone has had hay fever for the last 30 years, you cannot really eliminate it by giving them just 3 small spheres of a drug. No, it is the whole path. It's a long process, especially in the case of the diseases which we have suffered from since we were born. These are our tendencies we've had for years. In those situations, a homeopath would see this in a broader context.
Die ganze Familienanamnese, alle Krankheiten, die in dieser Familie bestehen.
The history must be taken about the whole history, the whole family. They will look at the diseases that would run in the family. I can give you an example. For example, we have someone who has recurring urinary tract infections. In those situations, we know what type of homeopathy will have to be given because, well, we as homeopaths, we know that we will find something in the family. We will always find rheumatism or arthritis, a tendency for obesity or depression, addiction.
Und die Krankheiten von den jetzigen Patienten ist ein Teil von
Then examining the diseases that occurred in the family of our patient in different generations is part of the analysis that is carried out by a homeopath to be able to find the right substance that will help.
Dann erfolgt sie immer von Zentrum zu Peripherie. Ich möchte euch ein ganz
If the treatment process moves on, it always goes from the inside to the outside. I would like to give you a case from my practice. Last week,
sehr gut gekleidet. Und sie kam,
a woman came to me. She was well dressed. She was quite fit.
eine chronische Husten hatte, die auf nichts
And she was
reagiert.
complaining
Sie hat alle schulmedizinische
for
Mittel
chronic cough
versucht. Es
for
wurde
30
ihr zwar
years,
eine
not
chronische
responding to any treatment. She already tried all different products, all different drugs. She was already diagnosed with chronic
Meine zweite Frage ist, was ist passiert vor 30
bronchitis,
Jahren? Ja,
and nothing
ich
helped.
habe eine schwierige
No
Zeit
drugs.
damals gehabt.
I asked her what happened 30 years earlier, and then she said, well, I had a difficult time back then.
Und mein Partner
I
hatte
was
sich
in a
verliebt in
relationship,
jemand anders und ich hatte die Kraft
but
nicht
my partner
wegzugehen.
found a different love,
Eine schwierige
and I was not
Situation.
strong enough to leave
Und sie
him.
ist
It was
trotzdem in dieser
difficult.
Beziehung relativ so ein gutes Jahr geblieben. Immer gehofft, dass etwas draus
And
wird.
she was in that relationship for one more year, hoping that something would get better. Unfortunately, nothing got better, and she decided to go abroad.
Sie sagt mir natürlich,
And when she arrived at a new place, she started coughing. Well, she said, okay, I went to Asia, the air was significantly polluted, and that was simply the cause of the coughing. No, no, no. That was about her emotional condition. Her emotional condition led to the coughing. I talked with her, and I put down all the symptoms, and I prescribed her a substance, and then I concluded that, well, perhaps you will have a physical reaction as a response to what you are getting, but you will feel better inside. It always goes from the inside to the outside.
Sie rief mich nach 5 Tagen an und sagt, ich kann mich kaum bewegen seit 5 Tagen. Ich sage, warum?
She called
Was
me
ist los?
5
Ich habe so heftige
days
heftige
later, and she said that she couldn't move for 5 days because she was suffering from a terrible pain in her neck.
schon gehabt? Ja, ich
She
hatte
couldn't
vergessen,
move.
Ihnen das
I
zu
asked
sagen.
her if she had ever suffered from similar thing in the past, and she says, yes, I forgot to tell you about that. But 3 times in my life, I had already had such symptoms, and I had had the pain in my neck.
Es ist so ein Prozess innerlich, Es ist gut, sagt sie mir, es ist gut,
That
aber ich
woman
kann's gar nicht
said that she was in a
beschreiben. Es
process, and then I
gut,
answered, fine, it
aber
is
es
good.
ist gut.
But I can't
Und
even
dann
describe
sagt
what
sie
is
mir,
happening. There are so many things are happening. It is good.
jeder
And she also
Knochen,
told me,
den ich je in meinem Leben gebrochen habe,
every
sie hatte
bone
auffällig viel Unfälle in ihrem Leben,
which I
aber
ever
jeder
broke in
Knochen
my
tut
life,
mir
well,
weh.
she had a number
Überall,
of
wo ich eine Fraktur
accidents.
habe. Ist
Every
unglaublich.
bone hurts me.
Aber mir geht es
Wherever
irgendwo
I
besser.
broke it, everything is
Trotz
hurting.
diesen Schmerzen.
But in general,
Ich habe
in
ihr
spite of
erklärt,
that,
das
I
ist
feel
eine
better. In spite of that
Paarreaktion.
pain, I feel better.
Das ist eine
And I
gute
explained it to her
Reaktion.
that it was the reaction of her
Diese
body, that
ich,
was a
also ihre
reaction to the
inneren
drug, that it
Lebensprozesse
was a
im
good
Körper
reaction,
reagiert,
proving that the
alte
treatment,
Symptome
the
kürzen wir
healing
auf.
was going on, that
Ich
her
habe ihr
body was
erklärt, dass
responding.
es
All the
in den
symptoms would
nächsten Tagen
subside. I also
sich
explained to her that on
verbessern
the
wird und
following
dass man
days,
nichts
she would
Besonderes
feel
da
the
machen muss. Man muss nur warten.
improvement,
Nur warten, wie
and
der
that it
Körper
was
wieder
not
sein
necessary to do
Gleichgewicht
anything
bekommen
else,
wird.
anything
Das
special, that it was
homöopathische
just
Mittel hat
necessary to wait
einen
for the body
Impuls
to
gegeben, der hat die
recover the
Lebenskraft
balance.
stimuliert. Der Mensch
That a
heilt sich
homeopathic
selbst.
drug
Als letztes
gave
möchte ich
the
Ihnen noch
strength to the body
einen
to
Fall
regulate the
erzählen.
uh,
Ist auch aus meiner Praxis.
possibilities of the very body. And now I
Es
would
ist
like to
eine
give you another case
88-jährige
from my
Frau,
practice.
3
It
Kinder.
was a 30-year-old woman who came to
Und
me. She
sie
had 3
hatte die
children,
Migräne, die seit 8 Jahren da war.
and she
Denn die
came to
Frau
me for
auch, ich frage
migraine.
immer, wie viele Kinder haben Sie?
She
7 Kinder.
suffered
Und die
for
hatte
the
ich
previous
gesehen
8
auch.
years. I always ask
Ein
my
Kind
patients
ist
how
der
old their
letzte Kind
children
ist
are, how many
18.
children they
Dann
have,
sagt sie,
and
ihre
then I
Migräne
noticed
seit
that her
8 Jahren.
last child was born 8 years
Die
earlier,
nächste
which
Frage
means that the
war
migraine
das
started when she was
3. Kind
having
geplant,
the last
gewünscht?
child. And my
Oder war
second
das
question was
einfach ein
whether that
Unfall?
was
Es ist
planned
natürlich
pregnancy,
gekommen, aber es war
expected
nicht
pregnancy,
geplant.
or was it an
Und sie
accident?
sagt mir,
Well, it was an accident.
nein,
The child was
eigentlich war
not
das
planned.
nicht
The
geplant.
pregnancy was
Aber natürlich
unplanned.
sind wir sehr froh und. Es war nicht geplant. Zu
Well, she
Beginn
said we
habe ich ein
didn't plan
bisschen
the
Mühe gehabt,
pregnancy,
weil
but
ich
we were
wollte
happy
wieder
about it.
anfangen zu arbeiten. Gut. Diese Aussagen, das sagten schon etwas über die Frau.
And
Dann
well,
frage ich, wie geht es in ihrer Ehe?
well, she said that at the beginning
Sie
I
hat
had some
Mann.
doubts because I just returned to work,
Als ich
but then we were
das
happy about it. I asked
sage,
later on
geht sie
about
mit
the
den
relationship in her
Augen
marriage,
runter und sagt,
and then I could see
schwierig.
that she started looking in
Nur
some other
indem sie das macht,
direction,
verstößt er wieder
saying,
mal
well,
ein
it is all
kleines
difficult. It
entschärftes Problem.
is, it's
Sie
difficult.
hat sich
And then I
die
concluded that we
Ehe
have a
war so
serious problem.
ein bisschen wackelig, nicht so gut. Und sie hat sich vor ein paar Monaten in
That marriage
einen
was not really
anderen
very
Mann
good. A
verliebt.
few months earlier,
Seither ist sie
she
verwirrt, sie weiß nicht, was
had
machen.
fallen in love with
Sie
some
möchte
other man,
eigentlich
and
neu
since
anfangen
then
in
she had
diesem
been sort of
Ort.
confused.
Diese
She
3 Kinder,
hadn't
sie
known what
ist in
to
einer
do. She
Klinikum.
would have
Sie
wanted
ist
to start new life
gefangen
with
in einer
that new man,
Klinik.
but she had 3 children, and she felt trapped.
Seither, sie ist sehr ungeduldig, sehr nervös. Sie verliert die Nerven schnell, sie
Since that
schreit
time, she was very nervous. She was very impatient. She was yelling at her children.
überfordert von der ganzen Situation und von allem. Alles nervt mich und ich muss so schnell
And
weinen.
she concluded that that
Frage ich sie
situation
einfach
was too
warum,
much, that she
was
was
ihr
actually
hilft.
losing
Sagt sie, was
patience
mir hilft,
very,
ist
very
Sport.
fast. I was
Ganz
asking
einfach
about
joggen
additional
gehen.
signs and
Einfach
symptoms
mit
and what
wirklich
helped her.
joggen gehen.
She said,
Das hilft
sports.
mir.
If I go for a run and I get tired, I get better.
Warum sie eigentlich ihren Mann nicht verlässt, frage ich sie. Frage ich ihr. Nur zum
I asked her why
Provozieren,
she
zum
didn't want to leave
Verstehen.
her husband.
Den Mensch kennenlernen.
I wanted to ask that question to
Sie
provoke
sagte
her
mir, ja, wissen Sie,
and
ich
to
habe
find out
Angst,
what
ich
she was
schaffe
like
das
as a human
finanziell
being.
nicht. Ich
And
habe
she answered,
keine
well,
sehr
I am afraid
gute,
that I will not be able to
gute
manage
Ausbildung.
financially.
Ich habe Angst, dass ich einfach
My education
vom
is not really very
Armgeld
good,
oder
and I am
vom
afraid
Sozialamt leben muss.
that I will
Auch
be
ich weiß nicht,
poor
ob ich
and
ich
I
das
will have
schaffe,
to live
dieses
on
abgeben,
some social
Antworten
benefits only. I don't
macht
know
mir
if
auch
I will be
Angst.
able
Also
to cope.
einerseits ist
I
sie
don't know if I will be
wie
able
eine
to take over
Kamel
the whole
eigentlich
responsibility
gefangen,
for my
andererseits hat sie Angst.
life. So on the one hand, she
Aber
was
in dieser
trapped. On the other hand, she was
Anstrengung,
afraid
mit
of
einer
doing
Migräne seit
something.
der Geburt
So
von
under
diesem
these
dritten Kind, auch
circumstances,
da war das Gleiche. Sie hat sich gefangen gefühlt. Sie wollte weiter,
well, we could see that her migraine started
arbeiten und sie
3 years
konnte nicht wegen
earlier,
dieser
together
Krankheit wieder
with
arbeiten,
the birth
und sie
of
konnte
the
nicht wegen diesem dritten
third
Kind.
child. She
Das
wanted to
Gleiche.
work, but
Und
she couldn't
Reform
because
hat
her
ein
third
gleiches
child
Prinzip.
was born. So it is a different form, but sometimes it is a different problem. Okay. So we also looked at other symptoms. I put everything down and I had very detailed notes, and then I also recommended Sepia XM to her. Sepia is a product that comes from the sea creatures. Very good, very good. And here, after 3 months, she came to me for a checkup, and she said that at the beginning she didn't feel not really very good. She was quite irritated, but she was getting more and more relaxed. She started to present with other symptoms. For example, I could see in her case the vaginal candidosis, and I also could see that she had 3 times very high fever, and very high fever is a very good symptom after the administration of homeopathic product. Her migraines remained unchanged. I was waiting for the next checkup, and I realized that the homeopathy is working. 6 months down the way, I asked her what it was like with her husband, and she said, I decided to stay with him. Now everything is clear. We work
Okay, right now
together.
everything is clear, and we're working on our problems. I had the sense that I see a different woman, which is much more stable. The migraine is no longer such a horrible thing for her, and I can see the improvement of the outside as well. So over this short period of time today, I wanted to demonstrate what is the link between the body and soul, and how homeopathy can help. Thank you very much for your attention. Thank you very much, Dr. Martina Hughes, for explaining how we can help from inside to outside. I hope that we will see her this year on our fall seminar, and we'll be able to personally speak with her.
Vielen Dank.
Auf Wiedersehen. Sehr
Alles.
Dank. Dankeschön.
Dalej.
Okay, let's continue.
Naszym kolejnym gościem,
Our next guest
jest profesor
is Professor
Gupta,
Pradip Kumar Gupta,
wybitny homeopata z
who
Indii.
is a great homeopath from India.
Króciutkie przedstawienie
And a
jego,
short introduction.
ponieważ w przypadku naszych gości można by tyle, ile trwa seminarium, poświęcić na przedstawienie.
I think we could spend lots of time to present their record. Professor Gupta is a rector of the medical university, which is called Naimitag. He's also the director of the hospital. He's also a head of the and he's also head of this Naiminat Institute. And this hospital is very interesting institution, because this is not a small clinic, but it's a very large hospital. He's seeing thousands of patients a year, and I made an attempt to find some information, statistical data about this hospital. What turns out, I don't know which year we have the data, but in this hospital, more than 2,000 cases of advanced cancers were treated. Also, the diabetes was treated. A number of millions of persons, diabetes number 1 and 2. This is a really big problem of the advanced societies. We have enough food, we have too much calories. It is not what is giving us what we, but we like it, and we like to, and then we suffer.
Jedyna rzecz, jaka nam zostaje, jeśli nie
Well, if not
stacjonarne leczenie nad morzem w Gdyni, w Polsce, no to niestety trzeba kupić bilet do Indii,
well,
Uttar Pradesh i
I think we need to go to Uttar Pradesh, and
najpierw myślałem, że 300, może 3000, a tutaj 30
we
tysięcy. To jest, wydaje mi się, jakimś niezwykłym.
and I think we have a serious problem with the microphone of the speaker. We can hardly hear what he's talking about. This is a disease from clinical standpoint is difficult.
Dyrekcją profesora.
Once again, we can hardly hear the speaker because of the microphone problems.
Również z niewydolności
So there is a number of other diseases that I can share with you to show you the context, to show you the achievements.
Również ten
Also, the hospital in the course of pandemics of COVID, we have a serious problem of the microphone of the speaker right now, and we can hardly hear him.
Które opiekowały się chorymi na COVID.
Could somebody do something about it? They were seeing a lot of patients during COVID pandemic as well, which were treated in this hospital with a good result. So that was by way of an introduction. Sorry that this is a short introduction, but we don't have much time, and I hand over to you. And thank you very much that you accepted our invite.
कुछ नहीं कर सकते मैंने उसकी भी सुन ली बस यही है चुप रहने
Panie profesorze, proszę, ma pan głos.
Professor, the floor is yours. The floor is yours, professor.
Podejrzewam, że mamy jakieś problemy.
I guess we have some technical difficulties. Yes, we've had, but shortly we are hoping to be receiving some professional support. Please bear with us.
Hello everyone, am I audible? Hello. बोलिए और क्या दोस्त कैसे पता लगे ऐसे case of hello good evening to everyone, hope I am audible and the screen is visible to all of you.
Dear professor, we see it. You can start.
Okay, thank you. So friends, the homeopathy is known to the chronic cases and the mild cases, or like very slow medicine may work, may not work. But here I will show you one case that you can understand what homeopathy can do. It is a case of multi-organ failure and refused to treat by a medical university. Here is the patient. In the patient is unconscious state last 15 days, not taking any command. He is in deep sleep, deep stupor. Also, he has a gangrene on left foot. Last 15 days, no urine output, as the urine bag is empty last 15 days. He is a chronic kidney disease patient and on the regular dialysis for last 2 years. So in this condition, his all the organ got failure and he became unconscious in a medical university where he was admitted, and he is unconscious last 15 days and no urine output last 15 days. This is the gangrene in his left foot. Patient was admitted in the medical university and there was no relief during course of treatment and followed by a progressive deterioration. And the deterioration, then they said, take it to the Naminath Homeopathic Medical College. So here I say one thing to all of you, that my hospital is famous for taking very serious cases which are not even treatable by allopathic medical colleges. I never say no to any patient whatsoever. I say, okay, let's try. So in this case, we start trying. This is the report discharge certificate from the medical university. Here they mention this follow-up case of chronic kidney disease. The past history of the patient, he has got malaria 5 years ago, appendectomy 3 years ago, and thereafter he developed this chronic kidney disease and he is on dialysis twice a week last 2 years. his hemoglobin at the moment is 6.6. And the serum creatinine is 15.4. This. So he is in very serious condition. Kidney are not working at all. Also, they have cyst, a multi-cystic kidney. Right kidney also have cyst, and left kidney also have two cysts. That's why this patient developed chronic kidney disease. When he got admitted in my hospital, his hemoglobin was 10 and his total leukocytosis count was 16,700. And his platelet was 1,54,000. His creatinine level was 13.4 and blood urea was 115.4, 9.4. This was condition when he got admitted in my hospital. So for me, this was the prescribing totality. When I prescribe a medicine to any case, I never see the disease. I see the symptom available that moment. At that time, patient was in deep coma, not responding to any stimulus. Eyes were wide open. Face was red and puffed. Pupils were dilated and fixed. You can see again this case here. I will show you. Here. So he is unconscious condition, not taking any command. I didn't see his urea is high, creatinine high. You see it, pupils are fixed and face is red and puffed. Look, his eyes are open and pupil are fixed and he is not giving any answer. So this was the condition and this was my prescription. Opium, LM1, 1 globule mixed in 100 ml water, from which 5 ml was given every 5-minute interval, 4 times. Then the 5th and 6th dose and 7th, 8th dose, 10-minute interval. So this is a course for 1 hour. And in 1 hour, we have given him 8 doses. Look after 1 hour. Now he is in the ward. Look, now on the command, he is little blinking his eyes. आपका नाम असलम है? Good evening, Dr. Farooq sir. So after 1 hour, you just again see the video. अंकल कैसे हो? ठीक हो? हाँ? आपका नाम असलम है? So within an hour, after 8 doses, the patient started responding. थोड़ा देर लेके कुछ कर On the next day, look this video. So only in one day, from deep coma, patient start taking food. You again see. This is a video of second day morning. Patient is lifting his head, enjoying the breakfast in the morning, and sitting with the support of the attendants. So this is the joy for a physician. Opium gave him new life. And this is all because of Master Samuel Hahnemann. He made opium potentized. Otherwise, opium will make him more sopor, more coma. So those who don't believe in dilution or potentization, this is a perfect example. What a potentized medicine. Otherwise, it is a very narcotic drug. Can save the life very easily. So day 3, patient is conscious, blinking his eye. Movement of hands and leg get increased. Trying to use his hand. In last 5 days, 3 days, the opium LM1 goes to LM5 because it is every hourly, and after 20 dose, the potency got increased. Look. Where's the day? मतलब ये नियम है। नहीं कोई बात नहीं, अगर आप ऐसा मतलब तो आ जाएगा। Look, now the patient is trying to eat himself. This was day 5. Patient is fully conscious, sitting without support, using his hand for doing his work, started speaking, demanding food and cold water, and in food especially cottage cheese. Opium LM5, 1 hourly diluted in 3rd cup. On the day 6th, look, he has started by eating himself only in 6th day. So this is homeopathy. Could you believe from here? And medical university refused to treat him because there is no chance of life. This man, and now after 6 days, this man. So this is the power of correct homeopathy. I wish every corner of the world people do like this work. Whatever doing, that is great work, but we need more good work. So I shown an example to you what a single remedy and what a homeopathic remedy, what can treat us. Okay, thank you very much. This is my presentation. If any question, then I will answer.
Dziękujemy serdecznie doktorowi Pradipowi.
Thank you very much. Thank you very much, doctor.
Ireni, kogo mamy
Dziękujemy
następnego?
And
bardzo
now,
panu
who is next?
profesorowi.
Thank you very much, professor.
I mamy kolejnego mówcę.
And now it is the next speaker towards whom we are heading. It will require a longer introduction. Dr. Farooq Master, similarly to Professor Kumar Gupta,
Był już w Polsce, gościł w
he
Polsce,
already
prowadził
was a guest in
seminaria
Poland. He conducted seminars for
Dr.
homeopaths.
Faruk również
Dr.
odwiedził
Karadip
Polskę i
also
prowadził
visited Poland and he
tutaj,
also conducted
seminarium.
a seminar here.
I Dr. Faruk Master,
Dr.
tak jak
Farooq
wcześniej
Master,
chyba już powiedziałem, jest
as I
niezwykle
said before, he is incredibly
płodnym autorem
fertile as an
ważnych
author
publikacji
of
właśnie
very
typowych
important
homeopatetycznych.
publications and
I tutaj
books on
króciutkie
homeopathy.
przedstawienie.
And now a few words of introduction, very few words of introduction.
Zajmuje się homeopatią od
He's been dealing in
1976
homeopathy
roku.
since
Proszę państwa, to się stanie
1976,
pół
so it's
wieku.
almost
W
half a
przyszłym roku
century.
będziemy obchodzili
Next year, we are going
50-lecie
to celebrate the
jego
50th
działalności. Kiedy
anniversary of
rozpoczął
his
swoje studia
activity. This is the time when he
rozpoczął
started his
swoje studia
medical studies and
homeopatyczne,
his studies in the
które
area of
ukończył w
homeopathy.
1979 roku
He graduated
egzaminami,
in
które były
1979
najwyżej
with the
punktowane
examination with the highest score
w tamtym roku, w roku
in
jego
that year. That was the year of his graduation.
egzaminów, dzięki czemu otrzymał złoty medal, jak
And
również
that is why he was
specjalną
awarded a gold medal as well as special award
gubernatora
of the
stanu
governor
Maharasztry.
of the
I
state of Maharashtra.
za swoje wybitne osiągnięcia, za
and
swoje
for his
wybitne
eminent
wyniki
achievements, for his
w
outstanding
dziedzinie
results
medycyny
in
i
the area
homeopatii.
of medicine and
Jako
homeopathy,
pierwszy
he was
wprowadził
awarded prizes.
homeopatię
He was the first one who introduced
w
homeopathy
usługach medycznych
as a
zarówno w
medical
sektorze prywatnym, jak
service,
i w
both in
sektorze
private as well
państwowym
as
Indii.
public
I
sector
tutaj
of
te
the
wielkie
Indian
firmy jak
healthcare.
Tata Sons,
Such large companies as Tata Sons,
nuklearne Coop Indii,
nuclear
również
companies,
Marynarka
COP of India,
Wojenna
also the
Indii,
Navy of
Armia
India,
Indii,
the Army of
te
India,
wszystkie
and
dziedziny
others.
prywatnego sektora
These
i
all
państwowego wprowadził
segments
opiekę
of state
zdrowotną,
owned as well as private sector were
Także
introduced
tutaj ma
to
wielkie
the
zasługi na
area
tym
of
polu.
homeopathic treatment. So his
Jest również
merits in this area are
konsultantem,
enormous. He is also a
homeopatycznym
consultant
konsultantem największego szpitala w
of the
Azji.
largest
Jest to
Asian hospital in the area
Mumbai
of homeopathy, and
Hospital,
this
czyli
is the Mumbai Hospital.
szpital w Mumbaiu. Niektórzy znają pod nazwą Bombay.
Well, you know it using the
Otworzył
former name,
również
Bombay. Now it's called
departamenty
Mumbai.
homeopatii, czy
He
też
also
oddziały
opened the
homeopatii
departments
w
of
różnych innych
homeopathy
szpitalach,
in many other
takich jak
hospitals, such as,
w szpitalu
for
King
example,
Edward's
the King
Memorial
Edward's Memorial
Hospital,
Hospital and
Jerbai Wadia
Jerbai
Hospital,
Wadia Hospital
Kamalanian
and Kamalanian,
Bajaj Oncology Center
Kamalanian Banjat Oncology
i
Center.
w innych również klinikach w Punie i w innych miejscach. I są to oddziały zajmujące się stricte
These
homeopatią.
are the departments dealing with strictly with homeopathy, and his particular contribution is to the treatment of cancers. Apart from that, the doctor Faruk Master is a lecturer in all of the continents. He's visiting the United States. He's also visiting all countries of Europe, but also he visits Asia, Australia. Well, he is a great teacher of homeopathy, and we had been so lucky that he already visited in Poland for a couple of times, and he received many awards, and it is impossible to give you every single name of the award. He's a titan of homeopathy, so very eminent. So, Doctor, I will get it over to you now.
Czekamy na
And we're waiting
pańskie
for
słowa, na pańską
your
wypowiedź.
words, for
Dziękuję.
your intervention. Thank you.
Hello. Can I start? Yes? Okay. So thank you all for inviting me to be on this panel with learned speakers from all over the world. Thank you, Dr. Arkadus and the Polish Association, the College of Dr. Arkadus. And good morning to all of you. The topic for today's webinar is possibilities of homeopathy. Since I practice homeopathic oncology, I would like to share my experience in the field of cancer and homeopathy, how homeopathy can contribute towards cancer. Now, despite all the genetic and epigenetic pressure, we don't get cancer most of our life because of our immune system. Cancer is in essence a failure of immune system to regulate abnormal cellular growth. And to understand cancer, you must first understand what cancer is not. Cancer is not a death sentence. Fear, anxiety, anger, and helplessness are all natural reactions when processing a cancer diagnosis. However, allowing these emotions to overcome you is counterproductive to the healing process. At Homeopathic Health Center and in my hospital, our goal is to help you wage a destructive war against cancer. Instead, we help you to rediscover the lost synergy of mind, body, and spirit as they work in tandem to heal you. All we ask from you is hope. Do not dwell on what has happened. but rather embrace what you are about to do. So what causes cancer? The derangement of the vital force first occurs at the general body level and then eventually expresses at the local level in a form of neoplasm or growth. This is what we understand. The susceptibility of an individual and his genetic history will predispose him to the disease in general, while weakness or sensitivity of a part system will lead to the localization of the disease in that area. The derangement always proceeds from functional to structural level. So the whole process of cancer production that we understand in homeopathy comes under the basis of carcinogenesis or oncogenesis, where normal cells are transformed into a cancer cell. And it is done in series of changes. First comes predisposition or the fundamental cause. In predisposition, we give importance to the past history and the family history. And that is the family miasm actually. In our hospital, we have found out past history of tuberculosis, cancer and diabetes, or family history of cancer, tuberculosis and diabetes play a very significant role. Then comes disposition. The individual who is thus born with a predisposition, they interact with the environment, thereby evolving mental and physical attributes, which together form the disposition. Then comes diathesis, which is the phase wherein the individual has a strong tendency to develop a particular disease and during which a stressful environmental stimulus initiates the onset of the disease. And awareness and avoidance of probable environmental carcinogens can delay the onset of the disease. And then we come to the preclinical phase of carcinogenesis, that phase that extends from inception of a cancer to the time that it produces recognizable sign and symptom. It takes several years after the onset of cancer for cancer to bother an individual or come to the attention of the doctor. The preclinical phase may last from 2 to 17 years. That is what we have seen. Why homeopathy? To understand the homeopathic approach to treating people with cancer, we must first clarify that homeopathic medicine not only treat the cancer, but more importantly, they treat the person with the cancer. The natural remedies individually prescribed on the basis of totality of the person's physical and psychological symptom reduce that person's susceptibility to disease. Once the concept is understood, it becomes very easy to assist patient. Homeopathic medicines not only help to control the growth of the cancer if brought to the homeopath in early stage, but they also help to alleviate the other accompanying symptoms like loss of weight, difficulty in eating, pain, weakness, cough, etc. Following are some of the aspects of cancer management with homeopathy. One of the most distressing complaints associated with some varieties of cancer is agonizing pain. Conventional medicine can provide pain relief, but only to a certain extent. And these medicines are not without any side effect. Moreover, there is always a restriction to the dosage that can be safely administered to the patient. The advantage of administering homeopathic medicine in such cases is that can have effective pain control without inducing any side effects. Homeopathy can help in improving the general well-being and vitality of the patient. Conventional treatment options for cancer, chemotherapy, radiotherapy are associated with distressing side effects, and homeopathy can play a definite role to counter these side effects. The diagnosis of cancer often leaves the patient with a sense of depression, anxiety, and fear. The treatment may include additional irritability, impatience, and mood fluctuations. Homeopathy can influence the psyche of the patient and help him to deal with the emotion in a better way. Homeopathic medicine may also have a role to play in controlling the pace at which the disease increases and spread to the disease to other organs. Now, why do cancer treatment like chemotherapy, radiotherapy stop working? Many patients diagnosed with cancer have far more treatment options now than they did even a decade ago. In some cases, this treatment can produce remarkable responses, completely eradicating tumors in patients whose cancer had spread throughout the body. But nearly all current treatment face the same problem for many patients. They ultimately stop working. Commonly known as drug resistance, this phenomena is one of the most challenging problems facing cancer researchers and patients today. When cancer cells resist the effect of drug used for treatment, they can grow to reform tumors, a process known as recurrence or relapse. Sometimes resistance develops quickly within a matter of weeks of starting treatment. In other cases, it develops in months or even years later. Resistance can occur when cancer cell, even a small group of cells within a tumor, contain a molecular change that make them insensitive to a particular drug before the treatment even begins. Because cancer cells within the same tumor often have a variety of molecular changes, this so-called intrinsic resistance is very common. In other cases of resistance, cancer cell may adapt to the drug while it is being administered, acquiring molecular changes that allow them to escape its effect. Why immunotherapy stops working? That's a very common thing that we see in our hospital. Our immune system has got an army of cells comprising of macrophages, T lymphocytes, natural killer cells, which destroys microbes and other invaders. But cancer cells manage to fool these brave soldiers using varieties of stratagems. In the last decade, immunotherapy has become a very viable treatment option for many cancer patients. Unlike radiation and chemotherapy, immunotherapy does not target the cancer itself. Instead, it enables the patient's own immune system to attack the disease. In most cases, immune-based treatments stimulate T cells, a specialized type of immune cell, to fight the cancer. Immunotherapy drugs called immune checkpoint inhibitors accomplish this by blocking checkpoints protein that live on the surface of T cell and acts as a brake to prevent the T cell from accidentally attacking healthy cell. However, checkpoint inhibitors don't yet work for everyone. Certain cancers, including pancreatic cancer, prostate cancer, glioblastoma, have been especially resistant to this approach. The idea that this agent works for some patients but not for others is a huge research question we are still trying to understand. In addition to immunotherapy causes some patients to suffer from major side effects due to hyperactivated immune system. CD47 acts like a chameleon. It is found on the surface of the cancer cell and makes them appear to be healthy. It tells the immune system not to destroy them, which leaves the door open for tumor growth and metastasis. Theories on the nature of cancer may be classified into two categories. One regards cancer strictly as a local phenomena, while second looks at the cancer as a local manifestation of a systemic process or disease. Although the first dominates current medical thought, the theory of immunological surveillance and a portovirus oncogeny implicitly assume cancer to represent a local manifestation of a systemic process of the disease. To start, ask your doctor which other options are available for your cancer. You may try a different type of immunotherapy drug, or you could start a therapy you have tried. If it turns out that immunotherapy isn't right for you, the treatment you'll try next will depend on few things, including your health, age, type of cancer, other treatments you have tried, and side effects of the treatment course. We can also think of naturopathy, homeopathy, complementary alternative medicine, and alternative medicine is used instead of standard treatment. Examples of complementary and alternative medicines is acupuncture, tai chi, yoga, mind-body therapies, vitamin, herbs, nutritional therapy, American Indian and Alaska native traditional healing practices. Alternative cancer treatment may not play a direct role in curing your cancer, but they may help you to cope with signs and symptoms caused by cancer and cancer treatment such as anxiety, fatigue, nausea, vomiting, pain, difficulty in sleeping, and stress. Alternative medicine is a term that commonly used to describe methods that aren't usually offered by healthcare providers. As research studies these treatments and the evidence of this alternative method grows, doctors and other providers are including them in the treatment plans along with the standard treatment. And that is what my hospital has now induced homeopathy as an alternative therapy to most of the cancer patients that we see. It's an approach that provides sometimes called integrative medicine. Using this evidence-based integrative medicine approaches along with standard treatment may help relieve many symptoms associated with cancer and its treatment. So these are some of the cancer fighting foods which are there. I'll be sharing this PowerPoint to Dr. Arcado, so I'm a little skip fast, like certain fruits like apple, grape, kiwi, orange, squash, berries, and the garlic drink, green tea that we advise in our hospital. I'm just expressing what we do in our hospital. Mihir oil, tomato, okra soup, tulsi leaves, turmeric. These are some of the vegetables which we advise our patient to consume in their lunch and dinner. Carrot, wheatgrass juice, and aloe vera drink. Some smoothies, papaya, pomegranate. Some type of seeds, dairy products like cheese and yogurt. Certain oils, coconut oil, cod liver oil, virgin olive oil, flax oil. Kinds of mushrooms like shikette mushrooms. Fish like mackerel, salmon, and sardines. Essential oil therapy, what is known as frankincense, essential oil, clove oil, rose oil, tree tea oil are very useful as aromatherapy. Now let us see the type of pain that we handle in our homeopathic department. The most important medicine that we use, I will do it from A to Z, is acetic acid, especially in hard cancer of the stomach, in the distant aperture opening into the duodenum. So once we exactly identify by MRI or PET scan the area where the cancer has started, and especially if there's a burning pain, better by lying on stomach, acetic acid. Whereas arsenic album and nitric acid has a sensation of fine needles. Arsenic bromatum, indurated tumors, but there has to be a lot of weakness and tendency to ulceration. Antimchloridum, beautiful remedy when there's a cancer arising from the mucous membrane with great prostration. Enanthurium, where there is a lot of ulceration, but the glands has to be inflamed, the lymphatic glands, and indurated. In apis, you will see burning sensation as if red hot needles. In arnica, breast adenoma, breast cancer, especially after trauma. Bryonia, pain better by rest and strong pressure, especially in cancer of the breast. Calcarea aceticum, especially when there is a constrictive pain anywhere in the cancerous process. Carbolic acid, sudden pain, terrible pain, discharges are putrid, ulcerating, especially in cancer of uterine and cervix. Cinnamonum, a beautiful remedy for pain and hemorrhage, especially if there's a hemorrhage due to uterine cancer. Choline is another very useful medicine we use as intercurrent remedy when liver function tests are totally abnormal in cancer of the liver. Cholesterinum for cancer of the gallbladder, pain, and cancer of liver. Eosin, whenever there is a burning pain of cancer, Euphorbium officinarum and eosin are very, very useful. Patient feels there is a burning pain as if there is a fire, but better by motion and walking. Fuligolingi. Fuligolingi is good for cancer of the uterus and scrotum and every sort of epithelioma of the skin. Gallium aparine, we use it for ulcerated cancer and nodular tumors of the skin and tongue. Hoangnan ameliorates the fertility and hemorrhage from the cancer. Macphos for spasmodic pain, better by heat. Ova tosta for cancer pains and wart. Ruta bruis pain, deep pain for cancer of the rectum. Now, radium bromide, especially for epithelioma due to radiation, cancer of the uterus, burning pain. X-ray, potentized X-ray for cancer of the skin, especially, and in cases of leukemia. The protocols that we use in our hospital for treating cancer patients. So basically, we have certain protocols when patient does not have not taken any treatment and come as a very virgin patient, and he has a strong family history of a cancer in the family, then definitely this is the best time to treat the patient homeopathically. We don't try to do surgical treatment in such patients. But if patient insists of surgery and patient doesn't want to trust homeopathy, then we say, okay, do surgery first and then go for homeopathy. Sometimes the lymph nodes are quite enlarged, but there is no symptom of cancer. Here also many times we advise surgery followed by homeopathy. If primary lesion is very big and non-operable, then you should think of homeopathy. If chemotherapy and radiation were not successful at all, then also try homeopathy. But in any case where the cancer is in the 4th stage with distant metastasis, I think so homeopathy can give you the best palliation. Tumor should be operated on as soon as possible because they can adhere to surrounding tissue and become inoperable. Many times this is what will be told to the patient by the cancer surgeon. But we have got some research done. One is the scientific evidence about homeopathy by Dr. Rajneesh Sharma in April 2010, where he talks about an experiment in the laboratory with 77 mice with a transplant fibrosarcoma, and 52% survive more than a year. So that's very important experiment that it was published in British Journal. And then pain control studies also. Scientists have found rodents given hypericum were able to inhibit pain responses. Rodents were able to remain on a hot plate longer than a control group. So this is another very important study. There are some wonderful papers presented in the International Homeopathic Congress on research in cancer and the Central Council of Research in Homeopathy. Because the time is too short, I cannot describe all the paper, but I would request you to go to the website of these organizations and read those papers. There is another Baltimore homeopathic study group also, where they have used Condurengo in stomach cancer and Conium with hard glands and found some good results. Cadmium sulf for cancer of the stomach, and especially when the patient is very chilly, and there is a black vomiting with lot of weakness and prostration, arsenic album. Euphorbium for the pain of the skin cancer in the last stage of cancer, when the cancer develops as an open wound. Now, this is very, very common in India, that we see many open wounds of cancer. And euphorbium is one of the best remedy if there is a burning pain, better by cold application. That's the modality. Arsenic iodide in a low potency I use in 3x or 6x when the wound is open and there is a lot of infection, or the wound going towards gangrene. When the wound goes towards gangrene, a lot of infection, arsenic iodide in 3x or 6x. Many tumors arising from kidney will call for kali salts, or magnesium phos is the best remedy, especially when there is a spasmodic pain due to kidney cancer. Neuralgic pain, many times I use aconite in a low potency, even mother tincture. Plumbum met and iodium has great affinity for colic and with constipation. So whenever there's an element of constipation and colic, plumbum comes to our mind. Symphytum is used for pain arising from bone tumors, sarcomas, osteoblastomas. Tuja, particularly suited for pain of the cancer of the rectum and breast. Now, Boning Ocean also advises us some medicines for early stages of cancer, as you can read over here. This is what he suggested, but we don't have much clinical evidence for that. Kant homeopathic medicines, also some grades, especially in the Zanderwood complete repertory, you will see them. This is what Kant is talking about, all the remedies. It's a long list, very long list. And then classical method that we use in our homeopathy, the Hahnemannian approach. Even though the patient in general felt better in relation to appetite, energy level, pain relief, but unfortunately tumor markers and size of the tumor hardly reduce, if at all it was marginal improvement. And many times metastasis comes up when we use a classical method. And hence, in such cases, you have to find out why homeopathy failed to reduce the size of the cancer or metastasis. Here, one of the answer could be repeated vaccination, suppression by surgical operation, chemotherapy, radiation. To neutralize this suppression, we need a powerful nosode, sarcodes, and potentized chemotherapeutic agents. So this is what we use a lot in our practice, because many times simple classical method does not give us a result when there's a lot of suppression. So certain chemotherapeutic drugs we have potentized in our hospital, as you can see over here. There's a very long list, and different kinds of carcinosin that we are using it in our practice. You can see over here, from different organs we have potentized and made carcinosin. These are the other remedies. We keep on adding remedies in our materia medica. So aconite lycotonum is one remedy when there is a swelling of the glands in axilla due to cancer of the breast. I'm little fast because the time is over. Alcohol is very good remedy. Alcohol mother tincture for pains of cancer. Enantium, where there is a burning pain, which I already mentioned to you. Enantium muraticum, when there is a swelling of the gland and there is a burning sensation, especially mammary gland, salivary gland, lacrimal gland. Apomorphine, a wonderful remedy, apomorphine, for alcoholism, opium habit, pregnancy of vomiting, seasickness, and vomiting of cerebral reflex, especially in brain tumors, especially in glioblastoma, where there is a severe vomiting. Asteria rubens, we all know, for cancer of the mammary, especially the left side, with lot of burning. Arsenic album we have already discussed, so I will not. But Avastin. Avastin we use a lot in colon cancer of metastatic type, especially as an intercurrent remedy, or non-small cell lung cancer, we use it, or renal cell carcinoma with metastasis. Sometimes for liver cancer also, and in an advanced case of glioblastoma recurrent, we use this Avastin in a potentized form. Sometimes in advanced ovarian cancer also we use it. When there is a non-healing wound in cancer, we use Avastin in a potentized form. It helps you to heal the wound. Then Boswellia serrata, it's a very important painkiller, especially when the pain comes from the cartilages or a bony structure. Calcarea aceticum, especially for headache due to brain tumors. Oxalatum also, when there is a pain in an open cancer. Cadmium aceticum, when there is a severe pain of cancer of the liver. Cadmium oxydatum, very useful for aluminum poisoning, producing cancer in the abdomen like colon, intestine, duodenum, stomach, etc. Capecitabine or Zeolda. This is a useful remedy intercurrently for hepatobiliary cancer, pancreas, peritoneal, ovarian cancer, and different kinds of cancer. Catharanthus. Catharanthus, from this plant, we get a very important medicine for chemotherapy known as vincristine. Cerium oxalicum, we use for cough reflex, dysmenorrhea, pregnancy, vomiting. Cisplatin, I use it in testicular cancer, ovarian, cervical, breast, bladder, head and neck cancer, esophageal cancer. But I also use when there's a severe leukopenia, thrombocytopenia, nephrotoxicity, ototoxicity, and hemo. I think so I should end over here because I'm too much time up. And this is some of the work which we do it in our hospital and help the patient. So thank you very much to the organizer once again, and wish you a lot of success for this Cancer Congress.
Merci, doktor.
Chciałem serdecznie podziękować doktorowi Farrokowi. Szczerze mówiąc, to miałbym milion pytań, bo to było niezwykle ciekawe. No ale rzeczywiście nie mamy czasu, także bardzo dziękuję, doktorze.
So thank you very much, doctor.
I mam nadzieję, że
And I'm hoping that I will have an opportunity to meet you in person soon. Thank you very much.
Jeremi, przenosimy się do
Jeremy,
Europy.
we are moving to Europe again,
Naszym wirtualnym
and our virtual plane is taking us,
mamy takie możliwości.
thanks to this remote connection.
Całą godzinę w Indiach.
You've been in India for 1 hour, and now we are landing in the Alps.
Tym razem
We are landing in Alps. Jens Wuster is the next speaker, who is a practicing medical doctor in Switzerland, in Germany. He's got a number of years of experience supporting the oncological patients with the use of classical homeopathy. From the beginning of his path, he wanted to find a way how to treat cancers after 20 years of working in Santa Croce, Swiss clinic. After seeing many patients and treating them, he opened his own practice where he is seeing his patients. Our researcher will talk about the possibilities of homeopathy during radiotherapy and chemotherapy. So, some kind of support for oncology patients. Hello, can you hear us, doctor?
Gdzieś nam nasz doktor.
It seems that we have some problem with the connection with the doctor.
Nie mamy połączenia z doktorem?
Don't we have a connection with the doctor? I can see him and he's saying something, but his microphone is on mute.
Ich kann Sie gut hören. Ich
glaube, Herr Doktor ist uns irgendwo verschwunden.
Nein, hören Sie mich?
Ja?
Okay, das ist gut. Ich habe gleichzeitig
Okay, I can hear you now. Well, and I also have an interpretation on my mobile.
Aber jetzt können Sie mich hören?
Ja?
Okay,
Can
wunderbar.
you hear me right now?
Kann ich anfangen? Sehr gut.
Great.
Okay.
And if so, we can kick it off. And I just wanted to tell you about my experience with regards to my last 20 years. I was working in Santa Croce clinic with my colleague who was the student of Dr. Constly. And at the beginning, we didn't know how to treat the cancer. It was quite a difficult thing. We only had some information from the old days, from our former authors. We were studying all these descriptions of the cases, and we were trying various methods. What was great about it was that we had various potencies of these medicines, and homeopathic means they were prepared by Dr. Kunstli, or they were prepared, and we started using them. We didn't know how to assess and how to adjust individual symptoms to individual potencies of these fluids and means. We just started this way, and I wanted to show you, using a number of cases, what kind of protocols can be deployed. And what happened was, just let me give you an example. We had a patient who arrived in 1990, and he had metastatic form of cancer. He was post-operation, but he had some metastasis, and we decided that we will deal with the symptoms that already are presented. Of course, the whole history of this patient is important. It was a person who was problem with sweating a lot. So with his armpit, and he's got various skin problems as a result of intense sweating, and fundamentally we arrived at a state whereby we had a problem of the cancer, and we dealt with melanoma, and we were thinking, should we deal with the basic problems or his cancer problem? We started from sulfonate, and then small potencies of the means, which led to the decrease of the pain in the armpit where we saw the metastasis. After half a year, the metastasis pretty much disappeared. However, what we observed was the improvement of chronic symptoms. So we saw the improvement of sleep, excretion, so the general state of the patient improved. For 23 years, I had treated this patient with sulfon only, and anti-COVID vaccine. Few weeks after this COVID vaccine, on the back of this patient, we saw skin changes, and once again, when we saw the papulas, there was a cancer which we couldn't stop. And if we actually treated this patient before the presentation of the cancer symptoms with sulfone, wouldn't have we not had a situation that he would have never had developed this cancer? This is the most fundamental question, and I think the most fundamental matter. The homeopathy can be a preventative intervention, and we had a similar observation in case of a different cancer or different patient when we had a more aggressive form of cancer than melanoma. We had a patient, he was treated in Frankfurt in Germany, when a professor told him that unfortunately his life expectancy will not exceed 5 years, and my patient got subjected to a radiotherapy, and this patient in parallel was subject to homeopathy, and I can say that this is the only person in the world who has lived for more than 20 years, and we have treated him homeopathically, not treating the current cancer symptoms, but the underlying primary symptoms. And before I move on to chemotherapy and radiotherapy, let me move on to a patient who had a stomach cancer. It was diagnosed that Helicobacter was the root cause of this cancer. He was treated with antibiotics prior to this intervention. It had not helped. He received 20 courses of chemotherapy, but unfortunately this cancer developed, and as part of the standard procedure, we had 20 courses of radiotherapy, and the cancer developed regardless. And of course, what we do as the next things is the extraction, the total extraction of the stomach. You just remove the stomach altogether. The patient was told about it. He was really stunned by that. He didn't want to allow that, and he wanted to try with homeopathy, and we told him that homeopathy at this stage is not going to help, but he still arrived at my location, and then we decided that his problem lies somewhere else. He had this permanent conflict. He was presenting various symptoms which were susceptible to Tuya treatment. He's got various skin problems. When we had some symptoms that were susceptible to Tuya treatment, so I started to use two treatments in alternate. Then I had a D6, and it turned out that this cancer decreased. The patient retained his stomach, and it turned out that homeopathy enables us to do deep changes in the person. What is very important is that homeopathy accompanies a human being, is trying to help him in his path, and of course, when he is operated upon, he is given arnica, and we are using some standard interventions which are supporting chemotherapy, like Homica, in patients who are vomiting, have nausea, and these are the effects of side effects of chemotherapy. I had a patient who had a tumor in his throat and also esophagus, and he had metastasis. Well, His wife was really getting on his nerves, and he was really getting very upset, and he had courses of chemotherapy and radiotherapy, but still this person was very kind of infuriated, and he was receiving morphine, and his wife sent him to me. He was so antsy that over the 2 hours of the intervention, he was very offensive to me. And I then thought that I will give him Slotka first, and I gave him Nux vomica, and I asked him to come back in 2 weeks. And then 2 weeks passed. This horrible person turned out to be a kind, nice person. Nux vomica enabled to take away from him this anger and this sense of being infuriated all the time. I think it was kind of the poisoning post-chemotherapy. And thanks to our intervention, we are able to get to the real person and to see what is this real person and not what he can be when he's just poisoned, because chemotherapy is all about administering the poison. This is another, arsenica is another important substance which we administer. It enables us to get rid of symptoms just like anxiety, a feel of cold, shivers, but also the fear and being intimidated. In the Arsenicum album is also alleviating the night anxieties. I had a patient who had a breast cancer, and she had such an anxiety that she was just pacing the room.
And also telling the stories that whenever she was waking up, in the sense of fear and anxiety, that the only thing coming up to his head is that to jump out of the window. I gave him Arsenicum album in co-potency, and already on day 2, it was possible for him to sleep the whole night. And this is really very interesting. This fear actually subsided. He slept well. He calmed down the whole system of his nervous system. His neurology was also getting better. And then it turned out that the immunological system that recovered was able to cope with the cancer. And then the cancer subsided. Calcium sulfuricum. It is also a very good substance that also works similarly to Arsenicum album. It also works in cases of vomiting. We had a patient who had a cancer that was connected with very severe vomiting. We gave her phosphorus, and we also gave her different other products. But as a matter of fact, we were not able to achieve an improvement. This patient stayed with us for over 2 weeks when finally she said that she could not kiss her husband anymore. And we were wondering what it meant. Perhaps she simply didn't like her husband anymore. And then she answered, well, I like him, but whenever I touch him with my lips, I feel nauseous. So jokingly, we looked into the repertory, and then it turned out that there was a symptom mentioned that was reduced to the sensation of nausea and vomiting when people touch things with their lips. And we gave her acoticum, and then it turned out that everything subsided. Just within one day, all the symptoms simply withdrew, and we were able to stabilize that patient. Well, other symptoms came up. She didn't feel very well indeed, even after that, but we have to admit that even in such cases, when we see vomiting, when patient suffers from diarrhea and suffers from nausea, it is very difficult to cure it. We have to admit that in many cases, homeopathy is just an additional modality of treatment added to other treatment. We also had another patient who was treated with homeopathic remedies after COVID vaccination. We were able to reduce the markers from 22,000 to 67 after the administration of caletonium. That patient lived for 3 more years. After that, there is another very important remedy that we can use together with chemotherapy is Okubaka. In D6. It can be administered every day. And this is a remedy that is used in cases of poisoning. Some of the African tribes invited each other for a meal, but it was not because they were so nice. They simply wanted to poison each other. One of the tribes, knowing that they were invited to eat something, but the purpose actually was to poison them. Prior to that meal, they took okupaka in order to counteract the consequences of the poisoning. There are many more substances like that, but these are the most important ones that I use. In the case of irradiation, there are also other substances that are most frequent. Our favorite one is phosphorus, which is able to eliminate the side effects of irradiation. A patient who is administered phosphorus in several doses will be able to overcome difficulties connected with side effects of irradiation.
Ähnlich wie Rußtoxicodendron will sich immer bewegen, es ist ruhelos, Wärme bessert. Und bei X-Ray, die sind
We also have to identify the following concept. Heat helps when they are being radiated. They don't want to move because they are quite depressive. Radium bromide, it is also similar to phosphorus in its activity. And it is also a very important substance. It is very important in case of tumors, especially with different abdominal and pelvic cancers, with the tongue cancer. It's a very frequent product which we use. I used to have an older patient who suffered from she suffered from the bladder cancer. No, it was the urine cancer. She was irradiated for that reason, and that was for her very bad because the doctors told her that she would not really present with a very good prognosis. And here I decided to administer radium bromide on her, and she didn't suffer from any difficulties. And the doctors were very surprised why she was standing it so well. And for 30 days, she was being irradiated, and there were no unpleasant side effects. She was really very happy about it. So when you have a closer look at how such cases can be managed, of those onco patients who come to us, what can we do? We have to perform the comprehensive analysis of such cases. We have to see what kind of a person it is, a person who has such a cancer. And we also have to have a closer look at the very cancer. We have to find out whether perhaps there are some local special characteristics of the tumor. For example, there is a woman with a breast cancer, and we have to find out what the consistency of that tumor is, whether it is hard, whether it is soft, whether it's like a sponge, or whether there is some cyst inside. It's very important to see deviations that can be observed, some special features, some special characteristics. And we also have to observe the feelings, whether it's the burning sensation or the stretching sensation or crinkling sensation. In general, it is called local symptoms. But for cancer, those symptoms are very important for the proper evaluation. Let us say we have, for example, a patient with sepia, and this patient presents with a hard tumor on palpation that is irritating her all the time. And it also causes very sharp pain, also itches. So we give her asconium. We also have to ask questions of her, whether she had some, the hitting injury of the breast, and whether she's suffering from dizziness. So we have to take the right history from her. It happens that we first we give one product and then we move on to something different. With sepia, for example, Cytolacca, we have such a satellite substance that we administer, D200. Sepia is the main remedy. Well, it should not be mixed up, but in cases of a cancer, sometimes it turns out that it is helpful, and then the tumor subsides. What else can I tell you? What can help? I had a case.
Am Brustbein oder auch Cancer vom Brustbein. Oft haben wir Conium als
For
wichtigstes
example, when we
Mittel.
have some bone injury, chromium is very important. Once I had a patient who had a bone metastasis, and the cancer already damaged her bones, and she had terrible pain. So I prescribed Symphytum C200 every day. It was a very special case, and then we noticed that her pain subsided, and the holes in her bones closed up. Her metastases to the bone disappeared. So she was asked by the doctor whether she had been irradiated, but no, we just used sulfitum, and it really helped. What else can be done as a support treatment to radiotherapy? What else can be proposed? For example, aloe vera can be used on the surface topically. It is a very good cream that helps out a lot. And the skin heals much faster. And additionally, for example, for women with breast cancer, we can give them the Hildegarda for Binden ointment made of violets. She's a mystic. And she noticed quite early that in cases of breast injuries, that ointment worked really very well. And then the science proved that it really is the case, that the cancerous cells have smell receptors. And the analysis was made which smells play a role here. Then it turned out that the breast cancer cells contain receptors that are focused on violets. And if the cancerous cell smells it, there will be a signal for the self-destruction of the cell. When I tell these stories to patients, they really believe that, and they are very willing to use it. How else can we support our patients? As Dr. Faruk Master described, good nutrition. It's about extracts, it's about proper fruit, it's about oils. In the case of cancer, nutrition is incredibly important. I know that it sounds banal, but we really have to pay attention to the level of sugar, not to allow for the peaks and the drops of glycemia. It is very important what can be done, just to eat some salad before the main meal, some vegetables, and then we will be able to prevent those peaks of glycemia. What else can we do when we have pain patients, patients with significant pain?
Wie ist die Art des Schmerzes? Wo ist der Schmerz?
When we have cancer patients, we are able to mitigate the pain when we provide homeopathy remedies to them. And we have to observe it very well. We have to try it out properly, and we will have to see what is happening when these patients suffer from the pain, what they do, what they instinctively do. There are really very many substances that can help out. Ladonia, for example. The worst pain can be significantly reduced. We had a patient also who was in bed and he suffered from terrible pain. I came to him, entered his room, and I just bumped into the patient's bed, and he got scared because it was like the shaking of the bed, which made his pain worse. Thanks to belladonna, I was able to reduce the pain. Sometimes belladonna works stronger than morphine. We really had plenty of patients. These were the patients who, throughout all these years, we noticed that there are gigantic changes that we can achieve. What is the prevention? The prevention is homeopathy, as well as chronic symptoms of the patients that we will definitely have to properly manage, because CAPS is just another step in the chronic disease. It is very important.
Serdecznie dziękujemy doktorowi za podzielenie się.
Okay, thank you very much for your knowledge and sharing this. And we are moving from the Alps to the seaside. We get back to Poland. Are we at the seaside now, Jeremy?
Zasłuchałem się, szczerze mówiąc.
I got really sucked up into this interesting lecture. It was a very interesting presentation. And
Ktoś musi wyłączyć mikrofon.
I think there's a problem with German interpretation.
Okay. Już jest lepiej, tak?
Okay, now it's better.
Mam nadzieję, już nie ma
I hope there is no
Jak mamy
interference.
kilka mikrofonów,
When we have
zdarza
a number of
się, że
microphones
internet
on,
jest
then
w
what
momencie
happens,
tak.
we have this
Ale
horrible
to nie
sound.
tylko
I
mikrofonów.
heard it too, but it wasn't from my
Pomagając
microphone.
technikach.
This is the
Jakość
technology,
niedoskonała.
which is still not perfect,
Ale dzięki
to be
homeopatii
sure,
mam nadzieję,
but thanks to
że
homeopathy,
dostali.
I hope it will improve.
To już był nasz ostatni
This was
gość.
the final guest that we had for today from abroad, and I'm hoping
Będziemy mogli porozmawiać
that
jeszcze
we'll be able
z
to
doktorem
discuss with our doctor, Arkadiusz Stankiewicz,
który
who
gdzieś nam się tutaj zagubił. Nie,
is
jest.
somewhere. I'm looking at him, but yeah, I can see him.
Dobrze.
Hello, doctor. Hello again.
Chciałem, tak?
Yes. I'm all ears.
Mam pytanie. Mam
I have a question.
pytań.
Number of questions, actually.
Wszystkie naraz zadać.
I'm not sure whether I'll be able to pose them all, but in sequence, doctor,
Pan tutaj o ośrodku
you
stacjonarnym.
said about the outpatient clinic and
Pracują
our guests, it appears, are working at that kind of hospitals, clinics, the stationary, not mobile centers, just like Dr. Jens in Santa Croce. And he mentioned when they started to do the treatment of oncological patients, also Dr. Faruk Master, I think he was connecting from his hospital directly. And the same applies to Professor Pradip Kumar Gupta,
widzieliśmy fragmenty
and we
filmu
saw
z sali
some
chorych,
fragments from the
przed izbą przyjęć, kiedy
patient's
mówiono o pacjentach.
room and also in front of the receiving area where his patients was brought. And in Poland, he also had this kind of non-mobile stationary center. And please tell me,
Ten ośrodek
is the
powstał
center
stosunkowo niedawno, ale jaka jest
established
historia jego powstania?
quite
Przecież
recently? What's the
powstał z
genesis?
czego? Czy
What's
z
the
jakiejś
origin?
pustki, czy z punktu zero?
Where
Tylko
did
coś
it
musiało
emerge from?
powstać.
What preceded this?
Mógłby pan doktor parę
Could
słów
you
chociaż powiedzieć?
give us a feel for that?
Idea tego
The very idea
powstania tego
of
ośrodka
establishing the
była
center
już w mojej głowie wiele lat temu.
was in my head for many, many years, and I kept thinking, how could we accelerate the therapeutic process in our patients? And when I was traveling to India or Switzerland, and when I was watching other centers, there was always this idea in my head
Już jest
that
czas, żeby
this is the time
rzeczy
to
tworzyć również
create
tu
these
na
things here
arenie europejskiej.
in Europe.
Na początku trochę
At the
trudno,
beginning,
trochę trudno te rzeczy robić, jeśli to
it is
doświadczenie
difficult to
z
do it when this experience is not so extensive. So always in homeopathy, when I teach, if you
również możesz wpaść w głęboką depresję, jeśli coś może
see your
iść nie tak.
results and the results are not good, you can get depressed. So it is worthwhile to have quite a long background and be emotionally stable to make sure that you can start such a center and you can provide this kind of assistance to the patients in Gdynia.
Były też zajęcia
Before that, we had small groups in PSHK center in Sopot. Then we had this established center, but without everyday visits. Then we had COVID pandemic, which was kind of watershed moment, kind of training range, because homeopathy showed quite an efficiency. And I can tell you that I was one of the few homeopaths who at the beginning worked well. Then we had some other medicines, but homeopathy, in case during COVID, demonstrated its capabilities and gave me the momentum to start it in other illnesses. Often the patients ask, I have the sickness, can you help me? The first assumption, we are not treating the illnesses, but the patients. So whether we can help is not whether we have a 50% rate of success in a given case, rather what the patient's bringing from his home, and also his tendencies to the diseases, and also the very pace of the processes in his body. These are the things and factors that needs to be factored in. I'm not saying anything new. Hahnemann was saying that upfront that we have these cases which were treated and they were not well treated. He saw relapses, and so that inspired him to ask why, and he found it in some kind of miasmatic burdens, and Dr. Hughes in his book, also in this kind of book is and also audiobook is published. These days we are busy all the time. We don't have time to take a book and think what's inside. We just want to have everything served. We even want to have knowledge in nutshell. We have the apps which are fishing for the most important sentences from the book so you don't waste time to deepen your knowledge. But let me share an anecdote. I remember one of the professors from my university, not everyone was keen on him. I like to visit. I will not share his name because this professor would say something interesting, something which would inspire me to develop. And one of my colleagues asked me, she says, why are you attending his lecture and classes? And I told her, how often do you hear that from him? I say that sometimes during one lecture, there's only one or three sentences. So would you go for just one sentence to this person? And I says, yes, because there's such a sentence which changes, which pushes me forward for just this one sentence. It is worthwhile to spend 1.5 hours. I don't know whether it will be spoken at the beginning, in the middle, or at the end. So I would sit and listen, and this is what can be detrimental to us. Often, at the beginning of our journey in this world, we want everything served in one pill. We don't want to waste time, but this is not the waste of time. This is a journey, and even if you're a child, I remember a daughter came to me and she said, Father, I may get a bad mark for math. And I said, honey, well, maybe this is your destiny, this is your karma, that you will get this bad mark and you will not pass to the next class. And I could have shocked her with this history or some parents, but I think that everything has its time and you should not accelerate something. And the love for our children requires care and also a good approach to make sure that we will not only push them to this rat race when which the most of the world partakes. Doctor, we heard that homeopathy works well with human beings. Does it have any wider use? Homeopathy works well on a human being. We are not talking about the treatment of patients with very difficult, severe diseases, just like cancers, not only in the emotional states. I remember a case or example when a gentleman was anxious, he had anxieties, he would come with his wife to my office. And after a number of meetings, when I saw that the wife is no longer there, I knew that the therapy went well. And I asked, where is your wife? Because she was always accompanying him. And he says, well, I don't have this need. He didn't even catch this moment that he changed his attitude, that he was no longer anxious. He got ambra. And what is characteristic that if we ask a question, this person repeats, so how do you feel? How do I feel? Wow. This is the description available in historical records, and he repeats the question before answering. And the patients can also, and we are getting into psychotherapy, they can have this nagging thoughts, which can be classified as not very nice for the environment. And after homeopathic therapy, the person regains the balance and he doesn't have these impulsive thoughts, because homeopathy, ladies and gentlemen and patients, works no matter whether you believe in it or not, and the efficiency of the treatment is unparalleled. And I'm not talking about myself, about my colleagues who are helping. They're involved, engaged in their work, and they do it with all their heart. And this is what I'm sure of.
Nic nie mają wspólnego z wiarą. Też możemy pomóc?
Can we help those? Can you repeat?
Chwilą. Domowym
Can we help our pets?
Teraz zrozumiałem.
No, I understood it.
Oczywiście
Of
domowym
course,
chwilom też możemy
you
pomóc.
can help your pet.
To sam zastosowałem.
I myself applied
U mojego pieska, który
in my dog,
i się do mnie dołączył do rodziny, można
and
powiedzieć. Leciał kiedyś za krzaków jakiś piesek i nagle się do mnie zbliżył,
well,
już nie chciał mnie
the dog came to me, and
historia rozpoczęła
this is how our common story started. For many years, this dog was accompanying my family,
Pamiętam, że któregoś
and I
razu
remember that at
nasz
some
piesek
point, our
z
dog
samego rana nie
in the
reagował na moje
morning
komendy,
was
nie
not
chciał
responding to
przychodzić
my
do
orders. He didn't want to come, so I came to him
się przyglądać,
and
co
I
się
was
stało z nim.
looking what
Wow,
happened, and I
popłakałem,
saw
nie
that
zmyłam jeszcze, nie dałem
he's
mu płasku
traumatized,
wieczorem
that I
przestać.
didn't
Ale
give
to
him a
nie była
sausage before his
to nie był
sleep,
ten powód.
but
Nasz
this was
piesek
not the reason
tu podpowiedziała
our
mi moja
pet,
żona,
and this is what my
poszedł po
wife told me,
i po
could have
prostu
swallowed
rzeczywiście jego rzeczy wróciły
an
jak
insect, a bee, and this is
Podałem
maybe the
mu
swelling
mleko
of
prosto do pyska,
throat and esophagus, and I gave him the medicine, hoping that it will help, and the dog swallowed this medicine.
lubię sprawdzać, czy to
Of course, I checked
czy to poprzez
whether
badania, czy to
it is
poprzez
effective,
wizyty kontrolne w
be it
ośrodkach
through control visits in the center.
Wyobraźcie sobie, państwo,
Imagine
że podjechaliśmy w
that
5-10 minut do
in
jakiegoś
5 or 10 minutes,
weterynarza w
we
okolicy
went to the veterinary's office in Chojnice. I remember that,
lubię, bo często
which
tam
I very much
wakacje
like
spędzamy.
because this is where I spent my
Pani
holidays. And
Dzisiaj mówi, rzeczywiście
Dr. looks,
ale schodzi.
this,
Zapomniałem dopowiedzieć,
the
że
swelling of the pharynx is moving away.
i otworzyliśmy
And I forgot to tell that when we opened the bonnet, the dog just jumped out. So he felt much better, and the doctor was interested. How could you so quickly help? And he asked the question, what did he get? Homeopathy. And he looked at me, no, it doesn't work.
And that I didn't really
And
lose a moment.
then
And then I said,
please tell it to the dog.
and very frequently in people there is no willingness, there is no happiness, because well, some people do not really want to consider it as a miracle, but it's very important for them to see that these are really realistic and repetitive therapeutic possibilities. I expect that every homeopathist is able to repeat the same result they are able to achieve. Their colleagues can also get similar results using homeopathy. So this is about repetitiveness. And I also can see another very interesting case. I hope that I will be able to present it.
Ale to znaczy, że możemy
Sorry for me
powiedzieć,
interrupting with
że
what you were
wszystkie
saying, but that
organizmy
means that we are able to say that all the living organisms respond to homeopathy. Is that correct? Yes, all the living organisms respond to homeopathy. And certainly also adults respond to homeopathy. Children also do when they do not know whether that these are homeopathic products. Animals also children, animals, and agrohomeopathy. It's about the treatment of homeopathy in crops. So homeopathy has really a very broad field of application. And I do not expect that vegetables or plants are convinced about them being sprinkled or hydrated with homeopathic drugs. And so from that moment on, they can be growing better.
A ja mam jeszcze pytanie,
And I also have a
jeśli
question,
można.
if I may.
Słuchając doktora Faroka w pewnym
Using
momencie,
Dr. Haruk,
musiałem się powstrzymać, żeby nie
I really
wybuchnąć
had to
śmiechem, prawda?
really
Odpuściła
stop
to
myself
poważna
from laughing
prezentacja
out
i
with laughter.
dotyczyła bardzo
Well, that was a very
chorób.
serious presentation. That was about very
Nie było
serious
się z czego
diseases, I
śmiać,
admit,
ale
and there was nothing really to
wymieniając różnego rodzaju
really laugh
leki,
about. But
pan
mentioning different
doktor Faruk
drugs,
Master
Dr. Faruk Master
Wymienił alkohol, po prostu
named
alkohol, że
alcohol,
podają
just
alkohol
alcohol,
w
saying
jakichś
that
tam
they give alcohol in
sytuacjach
some
bólowych,
specific
nowotworowych.
situations of
I
some
natychmiast, ale to
oncological pain,
natychmiast
for
pomyślałem
example. And
sobie, że u
immediately
nas
I
ta
simply
terapia
thought
to by
that this
nawet nie
therapy in
musiała się
our case
przyjmować,
wouldn't
bo jest
really have
niezwykle
to
popularna.
take time to take roots
I
because it is extremely
oczywiście nie mieliśmy
popular.
czasu
Of course, we
na
didn't
pytania
have
do doktora
time
Faruka, szczególnie, że
to
się
ask
spieszył do
questions of
pacjentów,
Dr.
bo
Farooq,
miał
especially
jakąś
that
tam
he was
sytuację
actually very
w
much in a
szpitalu.
hurry to
Ale
visit
od
with
razu
his
miałem
patients.
pytanie,
But I
iloprocentowy ten alkohol
immediately wanted to
należy
ask a
podać już
question
do
how
domu.
strong that alcohol should be
Czy
for
mógłby
it
pan
to
doktor
help the patients.
skomentować? Co
So,
prawda
doctor,
nie
can you
jest
please
to
comment on it?
pana
I know that
wypowiedź,
it is
ale
not about your
innego
statement, but that
z naszych
was about
prelegentów.
another of
O
our
jakim alkoholu po
colleague. But
prostu
what kind of
mówił?
alcohol he was talking about?
Nie wiem, o jakim doktor Farok
I
alkoholu
do not
mówi.
know
Mogę
what alcohol
powiedzieć,
Dr.
że
Farooq was talking about.
miałem taki jeden
I can just
przypadek
tell
w
you that
swoim
I had
życiu,
one
że w
case in my life,
praktyce
in my
przygotowałem
practice,
lek
that I myself
z
prepared a
tego,
drug
co rodzina mi
from
pokazała
what
u
the family
pacjenta,
showed
a
me
więc z tego, co
at the patients.
znaleźliśmy
So from what we found,
w resztkach, które zostały i w formie
uh,
nozody można było
and
podać,
that
ale
was
jak
in the form of
policzy
the
pacjent,
nozzle.
to
We
była
were able to
inaczej
administer
historia.
the drug. That
Pacjent,
story was
jak to
different.
doktor powiedział, zmartwychwstał, momentalnie
The patient resurrected,
był
and he was
pozbawiony pionu i
actually
zapadł w drugi głęboki sen.
revived, and
Natomiast
then
ta
he started to
historia doktora
sleep, and that was a healthy,
Faroka
good,
jest
strong
mi
sleep.
nieznana, także mi tu trudno
I do not
mówić
know
o
the story of
jakichś
Dr. Farooq, so it is
wynikach.
very
Mogę tylko
difficult
szukać porównań,
to
które miały kiedyś miejsce
respond to what he was
w
saying. I just
mojej
can talk
praktyce.
about the comparisons with what I did in my
Ale moje
practice.
pytanie dotyczyło też tego, czy to był rzeczywisty alkohol, czy po
But my
prostu
question was
kulecznik.
about whether it was really true alcohol or just sweet
Według mnie
spheres.
bardziej
I
mamy do
believe that
czynienia z
that then we have to do with
przygotowanym
the
jako
alcohol
lek
that is prepared as
homeopatyczny.
homeopathic product.
Także idziemy do
I
sklepu
understand.
gdzieś za rogiem i kupujemy.
It's not that we go to
Sam
the
pan
store
wszystko
just around the
zbiera, bo
corner, that we
homeopata
buy it, and we are
polecili.
supposed to drink it
Drodzy
because a
panowie,
homeopath would
nie
recommend
tędy
it. No,
droga. To
gentlemen,
nie
this is
tak,
not the
że
right way. That is not the right way. This is not the
Bo
right
w
therapy.
Polsce mogłaby być bardzo
Because I believe that
popularna.
in Poland it could be
mogłaby być
vastly
bardzo
popular. Yes, it could
popularna.
be vastly
Myślę, że to
popular, and I
nie
believe that it is not
droga.
really that case. It is not that direction, at least not this time.
Rozumiem. Jeszcze mam trochę poważniejsze pytanie.
And
Nie
I have
takie trudne.
another quite a serious question. It is not
Ponieważ
a
tutaj
joking
w
question,
pewnym
because
momencie, chyba tak
I
od połowy
believe
tej
that
konferencji, jednak temat
roughly
został
from
zdominowany
halfway through
przez
the
no,
conference, the
niezwykle
subject was
poważne
dominated
sprawy,
by very,
jak
very
nowotwory.
important, difficult questions, things like, for
I
example,
chciałem się
cancers.
spytać,
And
czy
I would
moglibyśmy
like to
usłyszeć
ask a
parę
question
słów,
if
jaka
we
jest
could find out a little
przeżywalność
bit about the
tutaj, jaka
survivability.
też
What
jest
is the overall
skuteczność i
survival? What is
przeżywalność
the
pacjentów
effectiveness
nowotworowych,
of
którzy są
the
leczeni
treatment of cancer patients who
homeopatycznie
are
lub też
treated
jako
homeopathically?
wspierającą
Or
terapię, bo
as
jak
the
rozumiem, jest
support
to z
therapy.
jednej strony
So,
wspierająca
because as you
terapia,
understand, it is just the
tak jak
supporting
doktor
therapy,
Jens o tym
as
mówił, ale
Dr.
z
Jens
drugiej
was talking
strony
about. But on the other hand,
też dr Farok
Dr.
i
Farok
Pradip
also and
mówili o
Pradip,
przypadkach
they talked about
takich
the
bardzo ciężkich,
cases
nawet
that
wręcz
were very
beznadziejnych,
difficult
gdzie
and sometimes
odmawia się
very
już pacjentom w
like
szpitalach
hopeless when
leczenia
patients
dalszego,
are refused to get
a
additional
jednak
further treatment in hospitals,
wykazywali
and
pozytywne
still they were
skutki.
able
I
to present with
ciekaw jestem,
positive outcomes.
jaka jest
So
opinia
I
doktora
wonder
na
what
temat
you
tej
think, doctor,
przeżywalności, czy
about
przetrwania
the survival, about
pacjentów
prolonging patients' life,
onkologicznych.
cancer patients, I mean.
Z mojego doświadczenia wynika,
From my
że
experience, I
bardzo
can say that it was very beautifully also mentioned by Dr. Jens
pokazał,
Wuste, who showed that there are some cases of patients to live 20 plus years after that. And these patients are,
nie są skazani na odejście z tego świata,
they are not
wrócili do żywych,
really
mogą się
sort of,
cieszyć,
condemned and
pomimo tego,
doomed.
że ta
They
metoda
return to living,
nie była
although their
prosta.
diagnosis was not
Powód z
positive.
przerzutami z mojego własnego
Because
doświadczenia
metastatic
jest
cancer,
czymś
also
takim,
from
że
my own
wbija
experience,
każdego pacjenta już na dzień dobry
actually
stan bardzo depresyjny.
makes
Jego
everyone very
kondicje
depressive.
idą na dół i w tym momencie
Their
bardzo
chances go
ciężko
down,
się
and then
pogodzić
it is really
tutaj w
very difficult
psychologii.
to
Mamy coś takiego też jak uraz
actually recover
jatrogenu,
from
uraz
that. We
jatrogenu.
also have a
Po
iatrogenic
wizycie u
injury, and it
specjalisty
means that after visiting with
pacjent
a
może
specialist,
mieć spadek
patients may
emocjonalny
present
na
with some
skutek
emotional depression
fałszywej
in the
diagnozy.
result
Czasami
of
to tak
the
się
wrong
rozproszymy
diagnosis, because some
w trakcie
diagnoses are simply
naszej
wrong. I've seen on a number of occasions that someone had the diagnosis that was really very, very negative. And if it was not really the case for him to go through the second opinion, they might have a feeling that they really have the disease that well, I'm here talking about. So this is also a very important subject in our work, in our practice. These diagnoses must always be second guessed or checked to make sure whether they really are genuine. And this is my opinion. And as far as the cancer is concerned, let me answer, as any other disease.
Z mojego doświadczenia to nie różni się od innych chorób.
There is no difference
Czy to
between
jest
cancer and
rak
other
piersi,
diseases,
czy to jest
whether it is
cukier,
multiple sclerosis
czy
or
to
Parkinson's
jest,
disease,
jakiś
or whether
inny
it is
nowotwór.
some other incurable terminal disease. As I said, most probably after the conference today, I'm going to get plenty of questions because since yesterday I have been having questions, and the questions are like that. I have this and that disease. When will it be better? Can it be better? Can I get better? Let me already say now. A homeopath, a reasonable homeopath, does the following. We never reject patients. And we tell them, we will see what can be done. Well, we take history, we give a drug, and looking at the response to the drug, we can say where we are. If a homeopath would say that, well, 100% there is full certainty that there will be the improvement, well, it is not ethical. You can't do that. It is not ethical.
Rozumiem.
I understand
Bardzo
that.
dziękuję.
Thank you very much for that. Thank you very much. And there is at least one case I would like to describe to you about. We have that inpatient institution. I actually yielded to the pressure last year, the pressure of a gentleman who wanted to come to me for treatment, and he couldn't come to the center of mine for a simple reason, because he spent all days in the lying position. He was not able to stand up. He couldn't really sit up. And now imagine that sometime after the beginning of the therapy, there was this miraculous healing. And this patient was able to sit up straight. So that was a reason for a great joy. And I was also very happy. The result was really great. And then on the following day, we have another meeting, and then I find out that this miraculous healing subsided. I was sad. And to my surprise, the patient said that I should not worry, because that miraculous healing is gone, whatever we call it, but the wound on his neck healed. That was an incredible statement. And then I was just wondering, who is a support for whom? Am I the support for the patient, or the patient is the support for me? Because he told me that I should not worry. Well, it doesn't really matter for him that he's in the bed again, but his wound has healed, so there is some advantage. As a homeopath, I simply knew that there was the moment of suppression, and that suppression
została wyleczona rana na palcu pacjenta, z której się sączyło,
due to the healing of the wound on the patient's leg caused the recovery of the symptoms. And then I told him that the following time when he would recover, this wound will start oozing again. And now we are continuing the treatment.
Proszę sobie wyobrazić,
Imagine,
jakiś czas później
sometime later,
osoba ta już zaczyna chodzić normalnie.
he started walking.
Ja zadowolony,
I
zadaję
was so happy,
pytanie,
and I asked him a question
czyli
about
z tej
it,
rany poszło sączenie.
about the oozing of the wound.
Pacjent odpowiada, nie,
And the
nic się
patient
nie
says,
zgłosiło.
no, nothing oozed.
Tym razem
This
znowu
time,
wielka konsternacja była na
again,
moim
there is
twarzy,
a
bo
big
nie było to zgodne z
consternation
zasadami
visible on my face because it was not in line with the
Miała
principles
być
of
sączenie,
homeopathy.
które zostało
Well, it was
stwierdzone,
supposed
miało być.
to see
A my
the
mieliśmy tej
oozing,
sytuacji.
and in this case, it was not visible.
Numer był taki niesamowity, że
And
mój chory uśmiecha się do
this
mnie i
patient
mówi,
is just smiling at me
sączenia
and
nie
saying,
było.
there was no oozing.
zobacz, dostrzegłem jego uśmiech i mówię, a co
I noticed
było?
him smile, so I asked him, and what happened? And he says, it started bleeding.
Poszła krew
Well, it started
i
bleeding.
proszę sobie wyobrazić, on się w ogóle
And
nie
imagine,
myślał, że jest coś złego.
he was not really
Przez
worried
po
something
paru
bad was
dni
happening
rana
within
się
a few
sama
days.
zagoiła.
That wound
I
healed,
ten pacjent, który leżał całe
and
dnie
the
w
patient who
łóżku,
spent
zaczął
all
chodzić.
days in bed
Cały końca
before that
terapii
started
jeszcze
walking.
występują jakieś
Well, this treatment
dolegliwości
is not finished
bólowe,
yet. There are
większe
still
powtórzenia na
some
brzuch.
complaints,
To jest
but still this
niesamowite
patient
i
is
nikt
now
nie wie
walking. It is
dlaczego.
incredible, and no one knows why it is happening so.
Ale homeopata wie, bo
But a
homeopata
homeopath knows
wie,
that.
jest terapią
But because a
skuteczną.
homeopath knows that
Także
homeopathy is an effective treatment.
myślę, że ta historia ma
So I
być
believe
też
that this
impuls,
story
światełko
is to
w
give
tunelu
a
i
stimulus. It is
nadziei,
that just
że i
like
dla
the light
ciebie
in the
jest
tunnel and
szansa
hope that there is also a
przekonać się
chance
do
for you.
właściwej terapii.
If you undergo
Musisz
the right
wierzyć
treatment, you
w
don't really have to
homeopatię.
believe in
Ważne,
homeopathy.
że się
What is very
zgłosisz do
important is that you
homeopaty.
simply come to a homeopath.
Bardzo dziękuję.
Thank you.
Powoli chyba nasz czas się kończy.
Our time is running
Nasz
out.
samolot wylądował.
Tak, nasz samolot wylądował z powrotem
Yes, our
w
plane
Polsce.
has landed again in Poland.
Prowadzącym pani
And I
Katarzynie
also would like to thank very
Chmielewskiej
much Katarzyna
za
Chmielewska
fajne
for a
prowadzenie
very
naszej
nice moderation
konferencji,
of
za
our
niesamowite
conference,
pytania,
for
za
her
dobrą
incredible
atmosferę.
questions and a very good
Panu Jeremiemu
atmosphere. I would like to thank Jeremy
Maślankowskiemu, którym znamy się
Maślankowski,
już wiele, wiele lat,
with
za
whom
to,
we
że
have
do
known each other
dzisiaj z
for
nami
a
jest,
very long
wspiera
time, for
nas
being with us, for
w każdym
supporting us
minucie naszej
at
konferencji.
any moment of our
Także
conference.
dziękuję wam za to, że
So
mogliśmy
I would like to
rozmawiać,
ask you very much for
dyskutować,
giving
jak
us an
wszystko
opportunity to
przygotować,
talk and
żeby
discuss
to
how to
mogło
prepare
służyć
things so that it
pacjentom.
could serve
I
the
na
purpose
zakończenie krótkie
of our
podsumowaniu
patients. And
nasi
finally, let me
uczestnicy
sum up.
uciekali do swoich
Our
panów
speakers are
prawnych.
already
Dziękujemy
gone.
więc
I
im
also
za
would
to,
like to
że
ask them
byli u nas,
for
poświęcili
being
swój
with us and
czas
for spending
i
their time
mam
with us.
nadzieję i wierzę w to głęboko, że
I
usłyszymy
hope and
się
I deeply believe
niedługo.
that we will meet again very soon.
Także chciałem podziękować
I also would like to thank
nieocenionemu doktorowi Stankiewiczowi
Dr. Stankiewicz
za zorganizowanie tej pierwszej
for
konferencji.
the
I
organization of the
tutaj,
first
proszę
conference.
Państwa, proszę zwrócić uwagę na tytuł. To jest
Please
pierwsza
look at the
konferencja
title.
homeopatyczna. Pierwsza.
It is the first
Co oznacza
homeopathic
pierwsza?
conference. It is the first
Jeśli
homeopathic
jest A,
conference. What does it mean?
to z pewnością
It means
też
that
jest
if there
B
is A, it will
i
definitely be followed by B.
mam nadzieję, że będzie
And
kolejna
I hope that there will be another conference,
na której będziemy mogli się spotkać
and that conference will be an
i
opportunity for us to meet
pokazać Państwu
and also
kolejną odsłonę
show to you
homeopatii.
the next phase
I
of homeopathy.
zapraszamy już na tą drugą konferencję, chociaż
We would like to
nie znamy
invite you to
jeszcze
the second
daty,
conference,
nie wiemy,
although we
kto
still do
będzie
not know the
prelegentem.
date. We do not know who is going to be the speaker during that
Oczywiście wielkie
conference.
podziękowania dla
We also would like to
naszych
thank very
gości z
cordially our
zagranicy,
guests from
bo
abroad,
to było niesamowite,
because
że
it was incredible that we were able
czterech
to
wspaniałych homeopatów w
meet
jednym
for
czasie, w jednym
great
miejscu
homeopaths at home in one place, in one location, that we were able to organize it. And all of them can be met separately at different seminars and different
To po raz
meetings.
pierwszy byłem
And
świadkiem takiego wydarzenia.
it is the first time when I am
I
witnessing such an event as this one.
dziękuję. Na
Thank you.
koniec
To conclude,
chciałoby się posłuchać Time to Say Goodbye
well, we would like to listen to Time to Say Goodbye
Boccellego.
by Andrea Bocelli.
Oczywiście przepisy prawa nie
But of course,
pozwalają
the law
nam
doesn't allow us to
tutaj
do that. We
muzyki,
can't really
więc
play the music in public.
niech każdy z Państwa sam sobie włączy i to jest
So
nasze
you can
pożegnanie.
turn it
Także
on.
bardzo dziękuję za cierpliwość.
Thank you very much
Dziękuję
for
za
your
wasze
patience. Thank you very much for
uczestnictwo.
your participation.
Chciałem przeprosić za wszelkie błędy techniczne, no ale tak jak mówiłem wcześniej, technika ma
And
swoje prawa i nie zawsze się chce słuchać człowieka.
well, the technique
Jeszcze raz dziękuję,
is quite
dziękuję
important,
Katarzynie,
but thank you very much. Thank you very much,
za
Katarzyna, once again
współtłumaczenie
for
i do
co-running.
zobaczenia. Do widzenia.
See you
Bądźcie
next time.
zdrowi.
Stay healthy.
Szanujcie i kochajcie homeopatię tak jak my ją
Respect and love
kochamy i
homeopathy
szanujemy.
just as
Do
we do.
widzenia Państwu.
Thank you very much.
Do
Goodbye.
zdrowia.
Do zobaczenia.
Goodbye.
Do zobaczenia.
Goodbye.